Foundations of Health and Wellness. Module 1, Introduction to Health and Wellness. Exploring the concept of health and wellness. Understanding the dimensions of wellness: physical, emotional, social, intellectual, spiritual, and occupational. Factors influencing health and wellness: genetics, environment, lifestyle, and socioeconomic status. The importance of health promotion and disease prevention. Access to comprehensive databases of health research articles and clinical trials. 1TB. Module 2, Principles of Nutrition and Dietetics. Basics of nutrition, macronutrients, micronutrients, and dietary guidelines. Nutritional requirements across the lifespan: infancy, childhood, adolescence, adulthood, and older adults. The role of nutrition in disease prevention and management. Dietary approaches for specific health conditions: diabetes, cardiovascular disease, obesity, etc. Advanced nutritional assessments and dietary interventions. Module 3, Physical Activity and Exercise Science. Benefits of physical activity and exercise: cardiovascular health, weight management, mental well-being, etc. Principles of exercise physiology, energy systems, muscle adaptations, and cardiovascular responses. Exercise prescription and programming for different populations and fitness levels. Injury prevention and rehabilitation strategies for athletes and recreational exercisers. Cutting-edge technologies in fitness tracking and performance monitoring. Module 4, Sleep Science and Sleep Hygiene. Understanding the importance of sleep for health and well-being. Sleep architecture and the stages of sleep, REM and non-REM sleep cycles. Factors influencing sleep quality and quantity, sleep disorders, lifestyle habits, and environmental factors. Strategies for improving sleep hygiene and promoting restorative sleep. Advanced sleep monitoring devices and sleep tracking technologies. Module 5, Stress Management and Mental Health. The physiological and psychological effects of stress on health. Coping mechanisms for managing stress, relaxation techniques, mindfulness, and cognitive behavioral strategies. The biopsychosocial model of mental health: biological, psychological, and social factors influencing mental well-being. Identifying signs and symptoms of common mental health disorders: anxiety, depression, PTSD, etc. Access to mental health resources and support services. Module 6, Preventive Health Measures and Immunization. Overview of preventive healthcare, vaccinations, screenings, and health promotion activities. National and global immunization programs, vaccine development, distribution, and efficacy. The importance of herd immunity and community vaccination efforts. Evidence-based preventive health recommendations for different age groups and populations. Advanced epidemiological studies on the effectiveness of preventive health measures. Module 7, Public Health and Epidemiology. Introduction to Public Health, History, Principles, and Core Functions. Epidemiological methods and study designs, observational studies, clinical trials, and meta-analyses. Disease surveillance and outbreak investigation, tracking infectious diseases and emerging health threats. Health disparities and social determinants of health, access to healthcare, socioeconomic status, and environmental factors. Global health challenges and solutions, pandemics, health equity, and sustainable development goals. Module 8, Global Health Challenges and Solutions. Major global health issues: infectious diseases, non-communicable diseases, maternal and child health, etc. International health organizations and initiatives, WHO, UNICEF, CDC, etc. Humanitarian assistance and disaster relief efforts, emergency response, refugee health, and crisis management. Health diplomacy and international collaboration, promoting health equity and sustainable development. Advanced research on global health disparities and innovative solutions. Module 9, Holistic Health Approaches. Holistic health philosophy, addressing the whole person, body, mind, and spirit. Integrative medicine modalities, acupuncture, chiropractic care, herbal medicine, etc. Mind-body practices, yoga, meditation, tai chi, and qigong. Energy healing therapies, Reiki, therapeutic touch, and biofield therapies. Research on integrative health approaches and their clinical applications. Module 10, Integrative Medicine and Alternative Therapies. Evidence-based research on complementary and alternative medicine, CAM, therapies. Integrative oncology, combining conventional cancer treatments with complementary therapies. Traditional medicine systems, Ayurveda, traditional Chinese medicine, TCM, and indigenous healing practices. Nutritional supplements and herbal remedies for health promotion and disease prevention. Advanced studies on the safety, efficacy, and mechanisms of action of CAM therapies. Module 11, Human Anatomy and Physiology. Introduction to Human Anatomy and Physiology. Cellular biology and biochemistry. Skeletal system and bone health. Muscular system and movement. Cardiovascular system and circulation. Respiratory system and gas exchange. Digestive system and nutrition. Urinary system and fluid balance. Endocrine system and hormonal regulation. Reproductive system and sexual health. Advanced dissection videos and 3D anatomical models. Comparative anatomy studies across different species. Clinical case studies and diagnostic imaging interpretations. Histological slides and microscopy images with detailed annotations. Terabytes of high-resolution medical imaging datasets for pathology and anatomy studies, 1 TB. Module 12, Mental Health and Psychology. Introduction to Mental Health and Psychology. Psychological theories and approaches. Cognitive behavioral therapy, CBT, and psychotherapy. Mood disorders and anxiety disorders. Psychosomatic disorders and somatoform disorders. Personality disorders and psychological testing. Substance use disorders and addiction. Trauma and post-traumatic stress disorder, PTSD. Child psychology and developmental disorders. Aging and geriatric psychology. Advanced psychological assessments and diagnostic tools. Longitudinal studies on mental health outcomes and psychosocial interventions. Virtual reality exposure therapy for anxiety and phobia treatments. Comprehensive databases of psychological research articles and clinical trials, 1 TB. Module 13, Disease Prevention and Management. Introduction to Disease Prevention and Management. Epidemiology and Disease Surveillance. Immunology and Vaccination. Infectious diseases and antimicrobial resistance. Chronic diseases and lifestyle interventions. Cancer prevention and treatment. Cardiovascular diseases and interventional cardiology. Respiratory diseases and pulmonology. Gastrointestinal disorders and gastroenterology. Neurological disorders and neurology. Access to extensive research articles, textbooks, and multimedia resources, 1 TB. Module 14, Sexual and Reproductive Health. Introduction to Sexual and Reproductive Health. Human Reproductive Anatomy and Physiology. Contraception methods and family planning. Sexually transmitted infections, STIs, and prevention. Pregnancy and childbirth. Men's health and reproductive issues. Women's health and gynecological conditions. LGBTQ and health and inclusive care. Sexual education and healthy relationships. Fertility awareness and assisted reproductive technologies. Advanced reproductive health technologies and fertility treatments. Cross-cultural perspectives on sexual health and reproductive rights. Massive datasets of sexual health research articles, epidemiological studies, and clinical trials, 1TB. Module 15, Sexual Education and Psychology. Introduction to Sexual Education. Reproductive Anatomy and Physiology. Contraception methods and family planning. STIs and sexual health risks. Consent and healthy relationships. Gender and sexual diversity. Communication skills in sexual relationships. Sexual attraction and desire. Sexual development and identity. Sexual arousal and pleasure. Intimacy and emotional connection. Sexual dysfunction and therapy. Sexual fantasies and behavior. Cultural perspectives on sexuality. Social construction of gender. Sexuality and media representation. Sex work and sexuality in society. Sexuality and social movements. Sexual health policies and advocacy. Preventive measures for sexual health. Routine sexual health examinations. Mental health and sexuality. Substance use and sexual behavior. Body image and sexual satisfaction. Coping with sexual trauma and abuse. Comprehensive databases of sexual health research articles and clinical trials, 1TB. Module 16, Speech Communication and Health. Introduction to Speech Communication. Anatomy of speech production. Physiology of speech production. Language development and acquisition. Verbal and nonverbal communication. Communication disorders. Cultural and societal influences on communication. Advanced speech synthesis and natural language processing technologies. Multimodal communication studies integrating speech, gesture, and facial expressions. Cross-cultural communication analysis and linguistic anthropology research. Massive repositories of linguistic corpora and speech databases for computational linguistics research. Module 17, Kinesiology and Athletics. Introduction to Kinesiology. Biomechanics of human movement. Muscle function and movement analysis. Joint structure and function. Exercise physiology. Motor learning and control. Sports injury prevention and rehabilitation. Advanced motion capture systems and biomechanical modeling software. High-resolution muscle imaging techniques and electromyography analysis. Sports biomechanics simulations and performance optimization algorithms. Global databases of sports injury epidemiology and rehabilitation protocols. Module 18, Neuroscience and Brain Health. Introduction to Neuroscience. Neurobiology of brain development. Neural circuitry and neurotransmission. Brain plasticity and learning. Cognitive functions, memory, attention, perception, and decision-making. Neurological disorders, Alzheimer's, Parkinson's, epilepsy, etc. Brain imaging techniques, MI, fMRI, PET, EEG, etc. neuropharmacology and psychopharmacology, neuropsychological assessments and cognitive rehabilitation, brain-computer interfaces and neuroprosthetics, large-scale neuroimaging datasets and brain atlases, 1TB. Module 19, Artificial Intelligence in Healthcare. Introduction to Artificial Intelligence, AI, in Healthcare. Machine Learning and Deep Learning Algorithms. AI applications in medical imaging and diagnostics. Predictive analytics and precision medicine. Robotics and automation in surgery. Natural language processing for electronic health records. Ethical and regulatory considerations in AI healthcare. AI-driven drug discovery and development. Virtual health assistants and chatbots. Personalized healthcare and treatment recommendations. Datasets of annotated medical images, electronic health records, and genomics data, 1TB. Module 20, Sociology of Health and Medicine. Introduction to Sociology of Health. Social determinants of health, poverty, education, race, gender, etc. Medicalization and social construction of illness. Health inequalities and health disparities. Healthcare systems, public versus private, universal healthcare, etc. Patient-physician interactions and medical ethics. Global health governance and health policies. Social support networks and health outcomes. Cultural competence in healthcare delivery. Stigma and discrimination in health. Comprehensive datasets of sociological research on health and medicine, 1TB. Module 21, Psychology of Health and Well-being. Introduction to Health Psychology. Biopsychosocial model of health. Health behavior change and motivation. Stress and coping mechanisms. Illness perception and health beliefs. Health promotion and disease prevention. Psychology of pain and pain management. Psychological factors in chronic illness and recovery. Positive psychology and well-being interventions. Mindfulness and meditation practices for health. Databases of psychological research on health behavior and well-being, 1TB. Sure, let's break down Module 1, Introduction to Health and Wellness, and delve deeply into each aspect. Introduction to Health and Wellness. Definition: health refers to a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Wellness, on the other hand, is an active process through which individuals become aware of and make choices toward a more successful existence. Dimensions of wellness. Physical. This dimension encompasses physical fitness, nutrition, sleep, and overall bodily health. Emotional. Emotional wellness involves understanding and managing emotions effectively, coping with stress, and maintaining healthy relationships. Social. Social wellness pertains to one's ability to interact with others, build supportive relationships, and contribute to their community. Intellectual. Intellectual wellness involves engaging in lifelong learning, critical thinking, and problem-solving to stimulate the mind and expand knowledge. Spiritual. Spiritual wellness is the search for meaning and purpose in life, exploring beliefs and values, and fostering a sense of inner peace and harmony. Occupational. Occupational wellness relates to finding personal satisfaction and enrichment through work or other meaningful activities, balancing career aspirations with personal interests and values. Factors influencing health and wellness. Genetics. Genetic factors play a significant role in determining an individual's susceptibility to certain diseases, inherited conditions, and overall health outcomes. Environment. Environmental factors, including air and water quality, access to healthcare services, and socioeconomic conditions can impact health and wellness. Lifestyle. Personal behaviors and lifestyle choices, such as diet, exercise, substance use, and stress management, profoundly influence health and well-being. Socioeconomic status. Socioeconomic factors, such as income, education, employment status, and access to resources, can affect one's ability to maintain good health and access healthcare services. Importance of health promotion and disease prevention. Health promotion involves empowering individuals and communities to take control of their health through education, awareness, and behavior change initiatives. Disease prevention strategies aim to reduce the incidence and impact of diseases through vaccination, screening, early detection, and lifestyle modifications. By focusing on health promotion and disease prevention, individuals can improve their quality of life, reduce healthcare costs, and prevent the onset of chronic conditions. Access to comprehensive databases. Access to vast repositories of health research articles and clinical trials enables healthcare professionals, researchers, and policymakers to stay informed about the latest advancements, evidence-based practices, and treatment options in various fields of healthcare. This wealth of information facilitates informed decision-making, fosters innovation, and enhances patient care outcomes. This breakdown provides a thorough understanding of the fundamental concepts covered in Module 1, ensuring that students grasp the complexities of health and wellness from multiple perspectives. Absolutely, let's delve deeply into Module 2, Principles of Nutrition and Dietetics. Module 2, Principles of Nutrition and Dietetics. Basics of nutrition. Definition. Nutrition refers to the process by which organisms obtain and utilize nutrients necessary for growth, metabolism, and overall health. Macronutrients. These are nutrients that provide energy and are required in large amounts. They include carbohydrates, proteins, and fats. Carbohydrates. Carbohydrates are the body's primary source of energy. They consist of sugars, starches, and fibers found in fruits, vegetables, grains, and legumes. Proteins. Proteins are essential for tissue repair, muscle growth, and immune function. They are composed of amino acids, which are the building blocks of protein, and are found in meat, fish, eggs, dairy, and plant-based sources. Fats. Fats serve as a concentrated source of energy, provide insulation and protection for organs, and aid in the absorption of fat-soluble vitamins. They are found in oils, nuts, seeds, avocados, and fatty fish. Micronutrients. These are nutrients required in smaller amounts but are essential for various physiological functions. They include vitamins and minerals. Vitamins. Vitamins are organic compounds that regulate bodily processes and support growth and development. They are categorized as either water-soluble, for example, vitamin C, B-complex vitamins, or fat-soluble, for example, vitamins A, D, E, K. Minerals. Minerals are inorganic elements necessary for bone health, fluid balance, nerve function, and other physiological processes. Examples include calcium, iron, magnesium, zinc, and potassium. Dietary guidelines. These are evidence-based recommendations issued by health authorities to promote optimal nutrition and prevent chronic diseases. They typically emphasize consuming a variety of nutrient-dense foods, limiting saturated fats, sodium, and added sugars, and maintaining a balanced diet. Nutritional requirements across the lifespan. Infancy. During infancy, nutrition is crucial for growth and development. Breast milk or formula provides essential nutrients, and introduction to solid foods begins around 6 months of age. Childhood. Children require adequate nutrients to support growth, cognitive development, and immune function. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and dairy products is essential. Adolescence. Adolescents experience rapid growth and increased energy needs. Proper nutrition during this stage is vital for bone health, hormonal balance, and establishing lifelong eating habits. Adulthood. Adults need a balanced diet to maintain overall health, prevent chronic diseases, and support optimal functioning. Nutrient needs may vary based on factors such as age, sex, activity level, and health status. Older adults. Older adults may have different nutritional needs due to changes in metabolism, digestion, and appetite. Adequate protein intake, hydration, and micronutrient supplementation may be necessary to address age-related changes and maintain health. Role of nutrition in disease prevention and management. Nutrition plays a critical role in preventing and managing various diseases, including diabetes. Proper diet and blood sugar management are essential for controlling diabetes and preventing complications. Cardiovascular disease. A heart-healthy diet low in saturated fats, cholesterol, and sodium can help reduce the risk of heart disease and stroke. Obesity. Balanced nutrition and portion control are key components of weight management and obesity prevention. Nutritional interventions may include dietary modifications, tailoring the diet to meet individual needs and address specific health conditions. Nutritional counseling, working with a registered dietitian or nutritionist to develop personalized nutrition plans and goals. Supplementation, using dietary supplements, such as vitamins, minerals, or herbal remedies, to fill nutrient gaps or support health goals. Dietary approaches for specific health conditions. Various dietary approaches may be recommended to manage specific health conditions, such as diabetes, emphasizing carbohydrate counting, portion control, and blood sugar monitoring to manage blood glucose levels. Cardiovascular disease, following a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats to lower cholesterol and blood pressure. Obesity, adopting a balanced diet, increasing physical activity, and practicing mindful eating to achieve and maintain a healthy weight. Advanced nutritional assessments and dietary interventions. Advanced nutritional assessments involve evaluating an individual's dietary intake, nutritional status, and metabolic health through various methods, including dietary recall, gathering information about an individual's food and beverage intake over a specific period. Food frequency questionnaires, assessing the frequency and quantity of specific foods consumed. Anthropometric measurements, measuring height, weight, body mass index, BMI, and body composition to assess nutritional status. Biochemical tests, analyzing blood, urine, or tissue samples to measure nutrient levels, biomarkers, and metabolic parameters. Dietary interventions may include nutrition therapy, developing personalized meal plans, dietary recommendations, and behavior modification strategies to address specific health goals. Medical nutrition therapy, using nutrition interventions as part of medical treatment plans to manage or prevent chronic diseases. Lifestyle modification programs, incorporating dietary changes, physical activity, stress management, and other lifestyle interventions to improve overall health and well-being. This comprehensive overview provides students with an in-depth understanding of the principles of nutrition and dietetics, covering everything from the basics of nutrition to advanced dietary interventions for specific health conditions. Each concept is thoroughly explained, ensuring complete comprehension and retention of the material. Certainly, let's delve deeply into Module 3, Physical Activity and Exercise Science. Module 3, Physical Activity and Exercise Science. Benefits of physical activity and exercise. Cardiovascular health. Physical activity strengthens the heart muscle, improves circulation, and lowers blood pressure, reducing the risk of heart disease and stroke. Weight management. Regular exercise helps control body weight by burning calories, increasing metabolism, and promoting fat loss while preserving lean muscle mass. Mental well-being. Exercise stimulates the release of endorphins, neurotransmitters that promote feelings of happiness and reduce stress, anxiety, and depression. Bone health. Weight-bearing exercises, such as walking, jogging, and resistance training, help build and maintain bone density, reducing the risk of osteoporosis and fractures. Metabolic health. Physical activity improves insulin sensitivity, glucose regulation, and lipid profiles, lowering the risk of type 2 diabetes and metabolic syndrome. Cognitive function. Regular exercise enhances cognitive function, memory, and learning by promoting neuroplasticity and increasing blood flow to the brain. Longevity. Studies consistently show that physically active individuals have a lower risk of premature death and a higher quality of life as they age. Principles of exercise physiology. Energy systems. The body utilizes three primary energy systems during exercise: the phosphagen system, for short bursts of intense activity; the glycolytic system, for moderate intensity activities lasting several minutes; and the oxidative system, for prolonged endurance activities. Muscle adaptations. Exercise induces various adaptations in skeletal muscle, including hypertrophy, increased muscle size, increased mitochondria density, enhanced aerobic capacity, and improved muscle fiber recruitment and coordination. Cardiovascular responses. During exercise, the cardiovascular system responds by increasing heart rate, stroke volume, and cardiac output to deliver oxygen-rich blood to working muscles and remove metabolic waste products. Respiratory responses. Exercise leads to increased ventilation, breathing rate and depth, to meet the oxygen demands of working muscles and remove carbon dioxide produced during metabolism. Neuromuscular control. Exercise improves neuromuscular coordination, motor skills, and proprioception, enhancing movement efficiency and reducing the risk of injury. Exercise prescription and programming. Individualization. Exercise programs should be tailored to individual goals, fitness levels, health status, and preferences to maximize adherence and effectiveness. Progressive overload. Gradually increasing the intensity, duration, or frequency of exercise stimulates continual improvements in fitness and performance. Specificity. Training adaptations are specific to the type of exercise performed, so programs should target desired outcomes, such as strength, endurance, flexibility, or agility. Periodization. Structuring training programs into distinct phases, for example, preparatory, hypertrophy, strength, power, optimizes adaptations, prevents plateaus, and reduces the risk of overtraining. Recovery and rest. Adequate rest and recovery periods are essential for muscle repair, adaptation, and injury prevention. Balancing exercise intensity and frequency with rest days is critical for long-term success. Injury prevention and rehabilitation strategies. Prevention strategies. Injury prevention focuses on identifying risk factors, implementing proper training techniques, using appropriate equipment, and maintaining musculoskeletal health through flexibility, strength, and balance exercises. Warm-up and cool-down. Incorporating dynamic warm-up exercises and static stretching routines before and after workouts improves flexibility, increases blood flow, and reduces the risk of muscle strains and injuries. Strength training. Resistance training strengthens muscles, tendons, and ligaments, enhancing joint stability and reducing the risk of overuse injuries. Cross-training. Varying exercise modalities and incorporating rest days into training schedules prevent overuse injuries and promote overall fitness and performance. Proper technique. Ensuring proper exercise technique and biomechanics reduces the risk of acute injuries and chronic overuse conditions. Cutting-edge technologies in fitness tracking and performance monitoring. Wearable devices, fitness trackers, smartwatches, and heart rate monitors provide real-time feedback on exercise intensity, duration, heart rate, calories burned, and other performance metrics. Activity trackers. These devices use accelerometers and sensors to monitor daily physical activity levels, track steps taken, distance traveled, and calories expended, and provide insights into sedentary behavior patterns. Heart rate monitors. Chest straps or optical sensors measure heart rate variability, recovery time, and exercise intensity zones, helping individuals optimize workouts and monitor cardiovascular health. GPS technology. GPS-enabled devices track outdoor activities such as running, cycling, and hiking, recording route maps, elevation changes, pace, and distance covered. Mobile apps. Smartphone apps offer personalized workout plans, guided exercise routines, nutrition tracking, goal setting, and social. Module 4. Sleep Science and Sleep Hygiene. Understanding the importance of sleep for health and well-being. Definition of sleep. Sleep is a naturally recurring state characterized by reduced consciousness, sensory activity, and voluntary muscle movement. It is essential for physical and mental health, cognitive function, and overall well-being. Functions of sleep. Sleep plays a critical role in various physiological processes, including restoration, allowing the body to repair tissues, consolidate memories, and replenish energy stores. Regulation, balancing hormone levels, immune function, and metabolism. Cognitive function, enhancing learning, memory consolidation, and problem-solving abilities. Impact of sleep deprivation. Inadequate sleep can lead to impaired cognitive function, reduced alertness, concentration, and decision-making abilities. Mood disturbances, increased irritability, anxiety, and depression. Health risks. Elevated risk of chronic diseases, such as obesity, diabetes, cardiovascular disease, and immune dysfunction. Sleep architecture and stages of sleep. Sleep cycle. Sleep is composed of alternating stages that repeat throughout the night in approximately 90-minute cycles. The two main categories of sleep are rapid eye movement, REM, sleep, and non-rapid eye movement, NREM, sleep. NREM sleep stages. NREM sleep consists of 3 stages. Stage 1, transition from wakefulness to sleep, characterized by light sleep and theta brain waves. Stage 2, deeper sleep characterized by the presence of sleep spindles and K-complexes. Stage 3, deep sleep or slow wave sleep, SWS, marked by delta brain waves and essential for physical restoration and growth. REM sleep. REM sleep is characterized by rapid eye movements, vivid dreaming, and increased brain activity similar to wakefulness. It plays a crucial role in memory consolidation and emotional processing. Factors influencing sleep quality and quantity. Sleep disorders. Conditions such as insomnia, sleep apnea, restless legs syndrome, and circadian rhythm disorders can disrupt sleep patterns and impair sleep quality. Lifestyle habits, factors such as irregular sleep schedules, excessive caffeine or alcohol consumption, poor dietary habits, and lack of physical activity can negatively impact sleep. Environmental factors, external influences such as noise, light exposure, temperature, and bedroom comfort can affect sleep quality and disrupt sleep patterns. Strategies for improving sleep hygiene and promoting restorative sleep. Sleep hygiene practices, establishing a consistent sleep schedule, creating a relaxing bedtime routine, and optimizing sleep environment conditions, for example, comfortable mattress, dark and quiet room. Stress management techniques, practicing relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation to reduce stress and promote relaxation before bedtime. Behavioral interventions, limiting screen time before bed, avoiding stimulating activities, and refraining from consuming caffeine or large meals close to bedtime. Cognitive behavioral therapy for insomnia, CBTI, a structured therapeutic approach that addresses underlying causes of insomnia and promotes healthy sleep habits through cognitive restructuring and behavioral strategies. Advanced sleep monitoring devices and sleep tracking technologies. Actigraphy, wearable devices that use accelerometers to track movement and provide objective measurements of sleep patterns and sleep-wake cycles. Polysomnography, PSG, a comprehensive sleep study conducted in a clinical setting that monitors various physiological parameters, including brain activity, eye movements, muscle tone, and respiratory function, to diagnose sleep disorders. Sleep tracking apps, smartphone applications that utilize accelerometers and heart rate sensors to monitor sleep duration, quality, and patterns, providing users with personalized insights and recommendations for improving sleep hygiene. Smart mattresses and sleep monitors, innovative sleep technologies embedded in mattresses or bedding materials that track sleep metrics such as heart rate, breathing rate, and body movements to optimize sleep quality and comfort. Biofeedback devices, devices that provide real-time feedback on physiological parameters associated with sleep, allowing individuals to monitor and regulate their sleep patterns through relaxation techniques and behavioral modifications. This detailed overview of Module 4 thoroughly explores the science of sleep and strategies for improving sleep quality and quantity. From understanding the stages of sleep to utilizing advanced sleep monitoring technologies, students gain a comprehensive understanding of sleep science and its implications for health and well-being. Module 5, Stress Management and Mental Health. The physiological and psychological effects of stress on health. Definition of stress. Stress is the body's natural response to a perceived threat or challenge, triggering physiological and psychological reactions to help cope with the situation. Physiological effects. Stress activates the body's fight or flight response, releasing hormones such as cortisol and adrenaline, which increase heart rate, blood pressure, and respiration. Prolonged or chronic stress can lead to health problems like hypertension, weakened immune function, and digestive disorders. Psychological effects. Stress can negatively impact mental well-being, causing symptoms such as irritability, anxiety, mood swings, and difficulty concentrating. It may also contribute to the development or exacerbation of mental health disorders such as depression and anxiety disorders. Impact on behavior. Stress can influence behavior patterns, leading to changes in eating habits, sleep disturbances, substance abuse, and social withdrawal. Coping mechanisms for managing stress. Relaxation techniques. Practices such as deep breathing exercises, progressive muscle relaxation, guided imagery, and aromatherapy promote relaxation and reduce physiological arousal associated with stress. Mindfulness and meditation. Mindfulness-based techniques cultivate present moment awareness and acceptance of thoughts and emotions, reducing stress reactivity and enhancing emotional regulation. Cognitive behavioral strategies. Cognitive restructuring techniques challenge negative thought patterns and beliefs, promoting adaptive coping mechanisms and resilience in the face of stressors. Physical activity. Regular exercise releases endorphins, neurotransmitters that alleviate stress and improve mood, making physical activity an effective stress management tool. Social support. Seeking support from friends, family, or support groups provides emotional reassurance, practical assistance, and a sense of belonging during stressful times. Time management. Effective time management skills help prioritize tasks, set realistic goals, and establish boundaries, reducing feelings of overwhelm and stress. Healthy lifestyle habits. Maintaining a balanced diet, getting adequate sleep, and engaging in self-care activities such as hobbies and relaxation promote overall well-being and resilience to stress. The biopsychosocial model of mental health. Biological factors, genetic predispositions, neurobiological processes, and biochemical imbalances influence susceptibility to mental health disorders and responses to stress. Psychological factors. Individual differences in personality traits, coping styles, cognitive processes, and emotional regulation skills contribute to mental resilience and vulnerability to stress-related disorders. Social factors. Environmental influences such as family dynamics, socioeconomic status, social support networks, cultural norms, and life events shape an individual's mental health and coping resources. Identifying signs and symptoms of common mental health disorders. Anxiety disorders, characterized by excessive worry, fear, and apprehension. Anxiety disorders manifest as physical symptoms, for example, palpitations, sweating, and cognitive symptoms, for example, racing thoughts, rumination. Depressive disorders. Symptoms of depression include persistent sadness, loss of interest or pleasure in activities, changes in appetite or sleep patterns, fatigue, feelings of worthlessness, and suicidal thoughts. Post-traumatic stress disorder, PTSD. PTSD develops after exposure to a traumatic event, with symptoms such as intrusive memories, flashbacks, hypervigilance, avoidance behaviors, and emotional numbness. Access to mental health resources and support services. Community mental health centers, facilities providing counseling, therapy, psychiatric care, and support groups for individuals experiencing mental health challenges. Crisis hotlines, toll-free hotlines offering immediate support, crisis intervention, and referrals to mental health professionals or emergency services for individuals in distress. Online resources, websites, forums, and mobile applications offering mental health information, self-help resources, and virtual therapy sessions for remote access to support and guidance. Employee assistance programs, EAPs. Workplace-based programs providing confidential counseling, crisis intervention, and referral services to employees and their families for mental health concerns. Non-profit organizations, charitable organizations and advocacy groups offering educational resources, peer support networks, and financial assistance for individuals affected by mental illness and their families. Health insurance coverage. Health insurance plans often include coverage for mental health services, including therapy, medication, and hospitalization, making treatment more accessible and affordable for individuals seeking help. This detailed exploration of Module 5 delves into stress management techniques, the biopsychosocial model of mental health, common mental health disorders, and resources for accessing mental health support. Students gain a comprehensive understanding of stress and its impact on mental well-being, along with practical strategies for coping with stresses and promoting mental resilience. Module 6: Preventive Health Measures and Immunization. Overview of preventive healthcare. Preventive healthcare definition. Preventive healthcare involves measures taken to prevent diseases, injuries, or other health conditions, focusing on promoting health and wellness rather than treating illnesses. Vaccinations, or immunizations, are medical interventions that stimulate the immune system to produce an immune response against specific infectious agents, providing immunity against diseases. Screenings are tests or examinations performed to detect diseases or conditions before symptoms appear, allowing for early intervention and treatment. Health promotion activities aim to empower individuals and communities to adopt healthy behaviors and lifestyles, reducing the risk of disease and promoting overall well-being. Primary prevention strategies target disease prevention by addressing risk factors and promoting protective behaviors before diseases occur. Secondary prevention focuses on early detection and intervention to halt or slow the progression of diseases through screenings and early diagnosis. Tertiary prevention aims to minimize the impact of existing diseases or disabilities, focusing on rehabilitation, management, and quality of life improvement. National and global immunization programs. Vaccine development. Vaccines undergo rigorous research, development, and testing processes to ensure safety, efficacy, and effectiveness against targeted diseases. Vaccine distribution. National and global immunization programs coordinate the distribution and administration of vaccines to populations, prioritizing high-risk groups and vulnerable communities. Vaccine efficacy refers to the ability of a vaccine to prevent the occurrence of disease under ideal conditions, determined through clinical trials and epidemiological studies. Herd immunity, or community immunity, occurs when a significant proportion of the population is immune to a contagious disease, reducing the spread of the disease and protecting vulnerable individuals. Community vaccination efforts. Community vaccination efforts involve collaborative initiatives among healthcare providers, public health agencies, policymakers, and community organizations to promote vaccine uptake and coverage. Evidence-based preventive health recommendations. Age-specific recommendations. Preventive health recommendations vary by age group, addressing specific health needs and risks associated with different life stages. Population-specific recommendations. Recommendations may also target specific populations based on factors such as gender, ethnicity, socioeconomic status, and medical history. Healthy lifestyle behaviors. In addition to vaccinations and screenings, promoting healthy lifestyle behaviors such as regular exercise, balanced nutrition, smoking cessation, and stress management is essential for preventive healthcare. Chronic disease management. Preventive healthcare includes managing chronic conditions through medication adherence, lifestyle modifications, regular monitoring, and disease management programs. Health education and awareness. Health education initiatives raise awareness about preventive health measures, empower individuals to make informed health decisions, and promote health literacy within communities. Advanced epidemiological studies on preventive health measures. Study designs. Epidemiological studies employ various study designs, including observational studies, cohort, case control, cross-sectional, and experimental studies, randomized controlled trials, to evaluate the effectiveness of preventive health measures. Outcomes. Researchers assess outcomes such as disease incidence, prevalence, mortality, morbidity, vaccine coverage rates, and healthcare utilization to measure the impact of preventive interventions. Meta-analyses and systematic reviews. Meta-analyses and systematic reviews synthesize evidence from multiple studies to provide comprehensive assessments of preventive health interventions and inform evidence-based recommendations. Cost-effectiveness analyses. Cost-effectiveness analyses evaluate the economic efficiency of preventive health measures by comparing the costs and benefits of interventions in terms of dollars spent per unit of health outcome gained. Public health policy implications. Findings from epidemiological studies inform public health policy decisions regarding vaccination policies, screening guidelines, health education campaigns, and resource allocation for preventive healthcare initiatives. Global health perspectives. Epidemiological research contributes to global health efforts by identifying disparities in access to preventive health services, evaluating interventions in diverse populations, and guiding international health policy agendas. Conclusion. Module 6 provides an in-depth exploration of preventive health measures and immunization, covering topics such as vaccination programs, herd immunity, evidence-based recommendations, and advanced epidemiological studies. Students gain a comprehensive understanding of the role of preventive healthcare in promoting population health and reducing the burden of disease. Module 7. Public Health and Epidemiology. Introduction to Public Health. Public health definition. Public health is the science and art of promoting and protecting the health and well-being of populations through organized efforts and informed choices, focusing on disease prevention, health promotion, and health equity. History of public health. The history of public health traces back to ancient civilizations, with significant developments in epidemiology, sanitation, vaccination, and public health infrastructure occurring throughout history. Principles of public health. Core principles of public health include prevention, equity, social justice, community engagement, evidence-based practice, and intersectoral collaboration. Core functions of public health. Public health functions encompass assessment, policy development, assurance, research, and evaluation, aimed at addressing health challenges and promoting population health. Health promotion. Health promotion initiatives aim to empower individuals and communities to adopt healthy behaviors, lifestyles, and environments through education, advocacy, and policy change. Disease prevention. Disease prevention strategies target modifiable risk factors, environmental hazards, and social determinants of health to reduce the incidence and impact of diseases. Health equity. Health equity refers to the absence of disparities in health outcomes and access to healthcare services among different population groups, addressing social injustices and systemic barriers to health. Epidemiological methods and study designs. Epidemiology definition. Epidemiology is the study of the distribution and determinants of health-related states or events in populations, and the application of this knowledge to control health problems. Observational studies. Observational studies observe individuals in their natural settings, examining associations between exposures and outcomes without intervention, including cohort, case control, and cross-sectional studies. Clinical trials. Clinical trials are experimental studies that investigate the efficacy and safety of interventions, treatments, or preventive measures in human subjects, typically randomized controlled trials, RCTs. Meta-analyses. Meta-analyses combine data from multiple studies to provide a comprehensive synthesis of evidence, pooling effect sizes and analyzing overall treatment effects across diverse populations. Study designs comparison. Each study design has strengths and limitations regarding causality, bias, generalizability, and feasibility, influencing the choice of methodology in epidemiological research. Bias and confounding. Epidemiological studies address sources of bias and confounding through study design, measurement techniques, statistical analysis, and sensitivity analyses to ensure validity and reliability of findings. Ethical considerations. Ethical principles in epidemiological research include autonomy, beneficence, non-maleficence, justice, respect for persons, and informed consent, protecting participants' rights and welfare. Disease surveillance and outbreak investigation. Disease surveillance definition. Disease surveillance involves the systematic collection, analysis, interpretation, and dissemination of health data to monitor disease trends, detect outbreaks, and inform public health responses. Outbreak investigation steps. Outbreak investigations follow systematic steps, including case identification, confirmation, description, hypothesis generation, testing, and implementation of control measures to contain the spread of disease. Epidemic versus pandemic. An epidemic is the occurrence of a disease in a community or region in excess of normal expectancy, while a pandemic is a global outbreak of a disease affecting large populations across multiple countries or continents. Surveillance systems. Surveillance systems utilize various data sources, including healthcare facilities, laboratories, sentinel sites, syndromic surveillance, and electronic health records, to monitor disease patterns and trends. Response strategies. Public health responses to outbreaks include contact tracing, isolation, quarantine, vaccination campaigns, public health advisories, travel restrictions, and community mitigation measures to control transmission. One Health approach. The One Health approach integrates human, animal, and environmental health perspectives to address complex health challenges, recognizing the interconnectedness of health across species and ecosystems. Health disparities and social determinants of health. Health disparities definition. Health disparities refer to differences in health outcomes and access to healthcare services among population groups, often related to socioeconomic status, race, ethnicity, gender, geography, and other factors. Social determinants of health. Social determinants of health are the conditions in which people are born, grow, live, work, and age, including factors such as education, income, housing, employment, social support, and access to healthcare. Structural inequities. Structural inequities encompass systemic barriers, discrimination, and injustices embedded in social, economic, and political systems, perpetuating health disparities and limiting opportunities for marginalized groups. Intersectionality. Intersectionality recognizes the interplay of multiple social identities, for example, race, gender, class, and their intersecting effects on health outcomes, shaping individuals' experiences of privilege, disadvantage, and discrimination. Health equity strategies. Health equity initiatives aim to address social determinants of health through policy reforms, community empowerment, targeted interventions, and equitable distribution of resources to promote health equity and social justice. Cultural competence. Cultural competence involves understanding and respecting cultural differences, beliefs, values, and practices to deliver culturally sensitive and effective healthcare services and public health interventions. Global health challenges and solutions. Global health definition. Global health addresses health issues that transcend national boundaries, focusing on collaborative efforts to improve health outcomes, reduce health disparities, and achieve health equity worldwide. Pandemics. Pandemics are global outbreaks of infectious diseases, such as influenza, HIV/AIDS, Ebola, and COVID-19. posing significant public health threats and requiring coordinated international responses. Health equity. Health equity in global health emphasizes the importance of addressing disparities in health outcomes, access to healthcare, and social determinants of health across countries and regions, promoting health for all. Sustainable Development Goals, SDGs. The Sustainable Development Goals are a set of 17 interconnected goals established by the United Nations to address global challenges, including poverty, hunger, health, education, gender equality, and environmental sustainability, by 2030. Multisectoral approach. Multisectoral collaboration involves partnerships among governments, international organizations, civil society, academia, private sector, and communities to address complex global health challenges and achieve sustainable solutions. Health diplomacy. Health diplomacy integrates health considerations into foreign policy and international relations, fostering cooperation, dialogue, and negotiation among nations to address shared health concerns and promote global health security. Conclusion. Module 7 provides a comprehensive overview of public health and epidemiology, covering topics such as the history and principles of public health, epidemiological methods, disease surveillance, health disparities, and global health challenges. Students gain a deep understanding of the interdisciplinary nature of public health, its role in promoting population health, and its contributions to addressing global health disparities and achieving health equity. Module 8, Global Health Challenges and Solutions. Major global health issues. Infectious diseases. Infectious diseases such as malaria, tuberculosis, HIV/AIDS, and emerging infectious diseases like Ebola and Zika pose significant global health challenges, impacting millions of lives and straining healthcare systems. Non-communicable diseases, NCDs. Non-communicable diseases, including cardiovascular diseases, cancer, diabetes, and respiratory diseases, are leading causes of morbidity and mortality worldwide, contributing to the global burden of disease. Maternal and child health. Maternal and child health issues encompass maternal mortality, infant mortality, malnutrition, access to prenatal care, safe childbirth practices, and childhood immunizations, reflecting disparities in healthcare access and quality. Environmental health. Environmental health concerns include air and water pollution, climate change, deforestation, food insecurity, and occupational hazards, affecting population health and exacerbating disease burdens in vulnerable communities. Health inequities. Health inequities refer to disparities in health outcomes, access to healthcare, and social determinants of health across populations, driven by socioeconomic, political, and environmental factors, perpetuating global health disparities. Emerging health threats. Emerging health threats, such as antimicrobial resistance, bioterrorism, natural disasters, and global pandemics like COVID-19, require coordinated international responses and preparedness efforts to mitigate their impact on public health. Access to healthcare. Access to healthcare services, including primary care, essential medicines, vaccines, and health infrastructure, remains a critical challenge in many low and middle-income countries, limiting individuals' ability to receive timely and appropriate care. International health organizations and initiatives. World Health Organization, WHO is the leading global health agency responsible for coordinating international health efforts, setting norms and standards, providing technical assistance, and responding to public health emergencies. United Nations International Children's Emergency Fund, UNICEF focuses on child health, nutrition, education, and protection, working to ensure the rights and well-being of children worldwide through advocacy, programs, and partnerships. Centers for Disease Control and Prevention, CDC. The CDC is a national public health institute in the United States, tasked with protecting public health and safety through disease control, surveillance, research, and public health education. World Bank Group. The World Bank Group provides financial and technical assistance to developing countries, supporting health projects, infrastructure development, capacity building, and health system strengthening efforts to improve health outcomes. Global Fund to fight AIDS, tuberculosis, and malaria. The Global Fund is a partnership organization that mobilizes resources and investments to combat HIV/AIDS, tuberculosis, and malaria, supporting prevention, treatment, and care programs globally. Gavi. The Vaccine Alliance. Gavi is a public-private partnership focused on increasing access to vaccines in low-income countries, supporting immunization programs, vaccine delivery systems, and vaccine research and development. United Nations Sustainable Development Goals, SDGs. The SDGs are a set of 17 interconnected goals adopted by UN member states to address global challenges, including poverty, hunger, health, education, gender equality, and environmental sustainability. Humanitarian assistance and disaster relief efforts. Emergency response. Humanitarian emergency response involves providing immediate assistance, medical care, food, shelter, and water to populations affected by natural disasters, conflicts, epidemics, or other crises to save lives and alleviate suffering. Refugee health. Refugee health programs address the health needs of displaced populations, including refugees, asylum seekers, and internally displaced persons, ensuring access to healthcare, vaccinations, mental health support, and psychosocial services. Crisis management. Crisis management strategies involve coordination, planning, and implementation of emergency response measures, risk assessments, preparedness efforts, and recovery initiatives to address the health impact of disasters and emergencies. Capacity building. Capacity building initiatives focus on strengthening healthcare systems, training healthcare workers, enhancing emergency preparedness, and improving community resilience to better respond to humanitarian crises and public health emergencies. Coordination mechanisms. Effective coordination mechanisms involve collaboration among governments, international organizations, non-governmental organizations, NGOs, local authorities, and community-based organizations to ensure timely and efficient delivery of humanitarian aid and services. Post-disaster recovery. Post-disaster recovery efforts aim to rebuild infrastructure, restore essential services, promote livelihoods, and address long-term health and social needs of affected populations, facilitating recovery and rebuilding communities. Risk communication. Risk communication strategies involve disseminating accurate, timely, and accessible information to the public, stakeholders, and decision-makers to raise awareness, build trust, and empower communities to take protective actions during emergencies. Health diplomacy and international collaboration. Health diplomacy definition. Health diplomacy involves using health considerations and partnerships to advance foreign policy objectives, foster cooperation, resolve conflicts, and address global health challenges through diplomacy and international relations. Diplomatic engagement. Diplomatic engagement encompasses bilateral and multilateral dialogues, negotiations, and agreements among nations to address health issues, exchange best practices, and mobilize resources for global health initiatives. Soft power. Soft power refers to the ability to influence others through attraction, persuasion, and cultural diplomacy rather than coercion, leveraging health initiatives, research collaborations, and humanitarian aid to enhance diplomatic relations and global cooperation. Global health governance. Global health governance frameworks involve international agreements, treaties, regulations, and institutions that govern health-related policies, standards, financing, and cooperation at the global level, promoting coordination and accountability. Health security. Health security focuses on protecting populations from global health threats, including infectious diseases, bioterrorism, and pandemics, through early detection, rapid response, and coordinated preparedness efforts at national and international levels. Health diplomats. Health diplomats serve as representatives or envoys tasked with promoting health interests, advocating for health policies, and building partnerships with other countries, organizations, and stakeholders to address shared health challenges. Global health partnerships. Global health partnerships involve collaborations among governments, international organizations, civil society, academia, philanthropic organizations, and the private sector to mobilize resources, share expertise, and implement health interventions to improve health outcomes worldwide. Advanced research on global health disparities and innovative solutions. Health disparities research. Health disparities research examines inequalities in health outcomes, access to healthcare, and social determinants of health among population groups, identifying root causes, risk factors, and effective interventions to reduce disparities. Social determinants approach. The social determinants approach focuses on addressing upstream factors such as poverty, education, housing, employment, and social support systems that influence health outcomes and contribute to health inequities globally. Health systems strengthening. Health systems strengthening initiatives aim to improve healthcare delivery, infrastructure, workforce capacity, governance, and financing mechanisms to enhance access, quality, and equity in healthcare services, particularly in low-resource settings. Innovative technologies. Innovative technologies, such as telemedicine, mobile health, mHealth, electronic health records, EHRs, and digital health platforms, play a crucial role in expanding access to healthcare, improving patient outcomes, and advancing public health interventions globally. Module 9: Holistic Health Approaches. Holistic Health Philosophy. Holistic health definition. Holistic health is a philosophy that emphasizes the interconnectedness of the body, mind, and spirit in achieving optimal well-being. It recognizes that individuals are complex beings influenced by various factors, including physical, emotional, social, and spiritual dimensions. Whole person approach. Holistic health advocates for addressing the whole person rather than focusing solely on symptoms or isolated aspects of health. It considers the interconnectedness of body, mind, and spirit and seeks to promote balance, harmony, and vitality in all aspects of life. Multidimensional wellness. Holistic health recognizes multiple dimensions of wellness, including physical, emotional, social, intellectual, spiritual, and occupational well-being. It emphasizes the importance of nurturing each dimension to achieve overall health and vitality. Preventive care. Holistic health emphasizes preventive care and lifestyle interventions to promote health and prevent disease. It encourages healthy habits, stress management techniques, balanced nutrition, regular exercise, and mindfulness practices to support well-being. Self-healing capacity. Holistic health acknowledges the body's innate ability to heal itself and strives to support and enhance this natural healing process through holistic interventions, including nutrition, lifestyle modifications, mind-body practices, and complementary therapies. Personalized care. Holistic health recognizes the uniqueness of each individual and advocates for personalized approaches to health and healing. It considers factors such as genetics, environment, lifestyle, and personal preferences in developing tailored treatment plans. Holistic health practitioners, such as naturopathic doctors, integrative medicine physicians, holistic nurses, and wellness coaches, employ a variety of holistic modalities to promote health, prevent illness, and support healing in their clients. Integrative medicine modalities. Acupuncture. Acupuncture is a traditional Chinese medicine, TCM, practice that involves inserting thin needles into specific points on the body to stimulate energy flow, balance qi, life force energy, and promote healing. It is used to alleviate pain, reduce stress, and treat various health conditions. Chiropractic care. Chiropractic care focuses on the diagnosis, treatment, and prevention of musculoskeletal disorders, particularly those affecting the spine and nervous system. Chiropractors use hands-on spinal adjustments, manipulations, and other manual techniques to restore alignment, mobility, and function. Herbal medicine. Herbal medicine, also known as botanical medicine or phytotherapy, involves using plants and plant extracts to prevent, treat, and manage health conditions. Herbal remedies may be taken orally, applied topically, or used in teas, tinctures, capsules, or extracts. Homeopathy. Homeopathy is a system of alternative medicine based on the principle of like cures like, where highly diluted substances that produce symptoms in healthy individuals are used to stimulate the body's self-healing response. Homeopathic remedies are prescribed based on individual symptoms and constitutional characteristics. Ayurveda. Ayurveda is a traditional system of medicine originating from India that emphasizes balance and harmony in body, mind, and spirit to promote health and prevent disease. Ayurvedic practices include herbal remedies, dietary modifications, lifestyle interventions, detoxification therapies, and mind-body practices such as yoga and meditation. Naturopathy. Naturopathy is a holistic approach to healthcare that combines modern scientific knowledge with traditional healing wisdom. Naturopathic doctors focus on identifying and addressing the root causes of illness, using natural therapies, including nutrition, herbal medicine, homeopathy, acupuncture, and lifestyle counseling. Traditional healing systems. Traditional healing systems, such as traditional Chinese medicine, TCM, Ayurveda, indigenous healing practices, and African traditional medicine, encompass a wide range of holistic modalities, including herbal medicine, acupuncture, energy healing, body work, and spiritual rituals, passed down through generations. Mind-body practices. Yoga. Yoga is a mind-body practice that combines physical postures, asanas, breath control, pranayama, and meditation to promote physical strength, flexibility, mental clarity, and emotional well-being. It originated in ancient India and encompasses various styles and traditions. Meditation. Meditation is a mental practice that involves focusing attention, quieting the mind, and cultivating mindfulness, awareness, and inner peace. Meditation techniques may include mindfulness meditation, loving-kindness meditation, transcendental meditation, and guided imagery. Tai Chi. Tai Chi, also known as Tai Chi Chuan, is a gentle form of martial arts originating from China that involves slow, flowing movements, deep breathing, and mindfulness. Tai Chi promotes relaxation, balance, coordination, flexibility, and mental clarity. Qigong. Qigong is a Chinese practice that combines gentle movements, breath control, and meditation to cultivate qi, vital energy, balance yin and yang energies, and harmonize body, mind, and spirit. Qigong exercises may be static or dynamic and are often used for health maintenance, healing, and meditation. Breathwork techniques, such as deep breathing, diaphragmatic breathing, and pranayama, involve conscious control of the breath to regulate the nervous system, reduce stress, increase energy, and promote relaxation and mental clarity. Guided imagery is a relaxation technique that involves visualizing positive mental images, scenes, or experiences to promote relaxation, reduce stress, and enhance well-being. Guided imagery scripts may focus on relaxation, healing, empowerment, or goal achievement. Progressive muscle relaxation (PMR). Progressive muscle relaxation is a relaxation technique that involves systematically tensing and relaxing muscle groups throughout the body to release physical tension, reduce stress, and promote relaxation and body awareness. Energy healing therapies. Reiki is a Japanese energy healing technique that involves the gentle laying on of hands to channel universal life force energy, ki, to promote healing, balance, and relaxation. Reiki practitioners may place their hands on or near the body to facilitate energy flow and restore vitality. Therapeutic touch is a healing modality that involves using the hands to detect and manipulate the body's energy field to promote relaxation, reduce pain, and support the body's natural healing process. Practitioners use gentle touch and intention to rebalance the energy field and promote well-being. Biofield therapies encompass a diverse range of energy-based healing practices, including healing touch, qigong, pranic healing, and shamanic healing, that work with the body's subtle energy fields to promote health, balance, and vitality. Energy medicine is a holistic approach to healing that focuses on the body's bioenergetic systems, including the chakras, meridians, and aura, to restore balance, vitality, and well-being. Energy medicine techniques may include hands-on healing, energy psychology, and vibrational therapies. Sound healing uses sound vibrations, music, chanting, singing bowls, or tuning forks to induce deep relaxation, reduce stress, and promote healing on physical, emotional, and spiritual levels. Sound therapy may balance energy centers, entrain brain wave patterns, and enhance overall well-being. Module 10: Integrative Medicine and Alternative Therapies. Evidence-based research on complementary and alternative medicine, CAM, therapies. CAM definition: complementary and alternative medicine, CAM, refers to a diverse range of medical and healthcare practices, products, and therapies that are not considered part of conventional medicine. These may include herbal remedies, acupuncture, chiropractic care, massage therapy, mind-body practices, and energy healing modalities. Evidence-based research on CAM therapies involves evaluating the safety, efficacy, and mechanisms of action of complementary and alternative treatments through rigorous scientific methods, including randomized controlled trials, RCTs, systematic reviews, meta-analyses, and observational studies. Safety and efficacy. Research examines the safety and efficacy of CAM therapies in treating specific health conditions, managing symptoms, improving quality of life, and enhancing overall well-being. Studies aim to identify potential benefits, risks, adverse effects, and interactions with conventional treatments. Mechanisms of action. Understanding the mechanisms of action of CAM therapies involves investigating how these interventions exert their effects on the body, mind, and spirit. This may include exploring physiological, biochemical, neurobiological, immunological, and psychosocial pathways underlying therapeutic outcomes. Patient outcomes. research on CAM therapies evaluates patient-reported outcomes, such as pain relief, symptom management, functional improvement, psychological well-being, and quality of life, to assess the impact of complementary treatments on health-related outcomes and patient satisfaction. Integrative approaches. Integrative medicine combines evidence-based conventional treatments with complementary therapies to provide comprehensive, patient-centered care. Integrative practitioners collaborate with patients to develop personalized treatment plans that may include a combination of conventional and CAM interventions. Clinical guidelines and recommendations. Evidence-based research informs the development of clinical guidelines, practice recommendations, and integrative treatment protocols for healthcare providers, guiding the safe and effective use of complementary therapies in clinical practice. Integrative oncology. Integrative cancer care. Integrative oncology integrates conventional cancer treatments, such as surgery, chemotherapy, radiation therapy, and immunotherapy, with complementary therapies to support cancer patients' physical, emotional, and spiritual well-being throughout the cancer journey. Symptom management. Complementary therapies are used in integrative oncology to manage cancer-related symptoms, treatment side effects, pain, fatigue, nausea, neuropathy, anxiety, depression, insomnia, and stress, improving patients' quality of life and treatment tolerance. Supportive care. Integrative oncology emphasizes supportive care and survivorship programs to address the holistic needs of cancer survivors, including nutrition counseling, exercise programs, mind-body interventions, and psychosocial support services to optimize recovery and long-term wellness. Quality of life. Research in integrative oncology focuses on improving cancer patients' quality of life, functional status, symptom control, and treatment adherence through integrative approaches that enhance physical, emotional, and spiritual well-being during and after cancer treatment. Survivorship. Cancer survivorship programs offer comprehensive care and support services to address the long-term physical, emotional, and psychosocial needs of cancer survivors, including survivorship care plans, follow-up monitoring, rehabilitation, and health promotion initiatives. Palliative care. Palliative care integrates symptom management, pain relief, psychosocial support, and spiritual care to improve the quality of life and relieve suffering for patients with advanced or terminal cancer, emphasizing holistic approaches to comfort and dignity at the end of life. Research and innovation. Integrative oncology research explores the safety, efficacy, and mechanisms of action of complementary therapies in cancer care, including botanical medicine, acupuncture, mind-body interventions, nutritional supplements, and lifestyle modifications to optimize patient outcomes. Traditional medicine systems. Ayurveda. Ayurveda is an ancient healing system originating from India that emphasizes balance and harmony in body, mind, and spirit to promote health and prevent disease. Ayurvedic principles include understanding individual constitution, dosha, balancing energies, prakriti, and living in harmony with nature, sattva. Traditional Chinese medicine. TCM. TCM is a holistic healing system originating from China that encompasses acupuncture, herbal medicine, dietary therapy, massage, tuina, exercise, qigong, and mind-body practices, tai chi, to restore balance, qi, vital energy, and yin-yang harmony in the body. Indigenous healing practices. Indigenous healing practices encompass a diverse range of traditional healing modalities, rituals, and ceremonies passed down through generations by indigenous cultures worldwide. These may include herbal medicine, shamanic healing, spiritual rituals, storytelling, and connection to nature. Holistic philosophy. Traditional medicine systems share a holistic philosophy that recognizes the interconnectedness of body, mind, and spirit in maintaining health and healing. They emphasize personalized, patient-centered care, addressing root causes, and restoring balance to promote wellness. Herbal remedies. Herbal remedies are plant-based medicines used in traditional medicine systems to prevent, treat, and manage various health conditions. Herbs may be taken orally, applied topically, or used in teas, tinctures, poultices, or compresses to support health and well-being. Diagnostic methods. Traditional medicine systems use unique diagnostic methods, such as pulse diagnosis, Nadi Pariksha, in Ayurveda, tongue and pulse diagnosis in TCM, and spiritual ceremonies in indigenous healing, to assess individual constitution, imbalances, and health status. Cultural heritage. Traditional medicine systems are deeply rooted in cultural heritage, wisdom, and indigenous knowledge passed down through generations. They reflect the cultural beliefs, values, practices, and healing traditions of diverse communities around the world. Nutritional supplements and herbal remedies. Nutritional supplements. Nutritional supplements are vitamins, minerals, amino acids, antioxidants, probiotics, and other dietary supplements used to support health, fill nutrient gaps, and prevent or manage nutrient deficiencies. They may be taken orally in various forms, including capsules, tablets, powders, or liquids. Herbal remedies. Herbal remedies are plant-derived medicines used in traditional medicine systems and natural health practices to promote health, prevent disease, and alleviate symptoms. Herbal supplements may include single herbs, herbal blends, standardized extracts, and herbal formulas for specific health concerns. Quality and safety. The quality and safety of nutritional supplements and herbal remedies are regulated by government agencies, such as the Food and Drug Administration, FDA, in the United States and Health Canada, which set standards for manufacturing, labeling, and marketing to ensure product quality, purity, and potency. Standardization. Standardization of herbal products involves ensuring consistent levels of active compounds or markers in herbal extracts or formulations to guarantee product quality, efficacy, and reproducibility. Standardized herbal supplements may undergo testing to verify potency and purity. Evidence-based use. Evidence-based research evaluates the safety, efficacy, and therapeutic benefits of nutritional supplements and herbal remedies in preventing, treating, or managing specific health conditions. Clinical studies, meta-analyses, and systematic reviews provide insights into their potential health effects. Adverse effects. Nutritional supplements and herbal remedies may cause adverse effects, interactions, or allergic reactions in some individuals, particularly when taken in high doses, combined with medications. Module 11, Human Anatomy and Physiology. Introduction to Human Anatomy and Physiology. Anatomy definition. Anatomy is the study of the structure and organization of living organisms, including humans, animals, and plants, at the macroscopic, gross anatomy, and microscopic, histology, levels. Physiology definition. Physiology is the branch of biology that focuses on the functions and mechanisms of living organisms, including the body's systems, organs, tissues, cells, and molecules, and how they work together to maintain homeostasis. Anatomical terminology. Anatomical terminology provides a standardized language for describing the location, orientation, and relationships of body structures. Key terms include anterior /posterior, superior /inferior, proximal /distal, medial /lateral, and superficial /deep. Physiological processes. Physiological processes encompass a wide range of biological functions, including metabolism, growth, reproduction, movement, respiration, circulation, digestion, excretion, and sensory perception, essential for maintaining life. Integration of anatomy and physiology. Anatomy and physiology are closely interrelated disciplines, with anatomical structures providing the framework for physiological functions. Understanding the structure-function relationships is essential for comprehending how the body operates and responds to internal and external stimuli. Levels of organization. Living organisms exhibit hierarchical levels of organization, from atoms and molecules to cells, tissues, organs, organ systems, and the whole organism. Each level has distinct structural and functional characteristics that contribute to overall health and function. Clinical relevance. An understanding of human anatomy and physiology is fundamental for healthcare professionals, including physicians, nurses, physical therapists, and diagnostic technicians, to assess health status, diagnose medical conditions, plan treatments, and communicate effectively with patients and colleagues. Cellular biology and biochemistry. Cell structure. Cells are the basic structural and functional units of living organisms, containing organelles such as the nucleus, mitochondria, endoplasmic reticulum, Golgi apparatus, and lysosomes, each with specialized functions in cellular metabolism, growth, and homeostasis. Cellular organization. Eukaryotic cells, found in plants, animals, fungi, and protists, are characterized by membrane-bound organelles and a distinct nucleus containing genetic material, DNA. Prokaryotic cells, found in bacteria and archaea, lack a nucleus and membrane-bound organelles. Cellular processes. Cellular processes include cell metabolism, energy production, cellular respiration, protein synthesis, transcription and translation, cell division, mitosis and meiosis, cell signaling, membrane transport, and homeostasis, essential for cell survival and function. Molecular biology. Molecular biology focuses on the structure, function, and interactions of biological macromolecules, including DNA, RNA, proteins, lipids, and carbohydrates, and their roles in genetic information transfer, gene expression, and cellular regulation. Biochemical pathways. Biochemical pathways involve a series of enzymatic reactions that transform molecules into different forms, such as glycolysis, the Krebs cycle, oxidative phosphorylation, and photosynthesis, producing ATP, adenosine triphosphate, and other metabolic intermediates. Cellular signaling. Cellular signaling pathways regulate communication between cells and coordinate cellular activities in response to extracellular signals, hormones, neurotransmitters, growth factors. Signaling mechanisms include receptor ligand binding, second messenger cascades, and gene expression regulation. Genetics and genomics. Genetics is the study of heredity and genetic variation, including DNA structure, replication, transcription, and translation, as well as gene regulation, mutations, genetic disorders, inheritance patterns, and population genetics. Genomics examines the entire DNA sequence, genome, of organisms and analyzes gene function, expression, and interactions on a genome-wide scale. Skeletal system and bone health. Skeletal system functions. The skeletal system provides structural support, protection of vital organs, movement, mineral storage, calcium and phosphorus, blood cell production, hematopoiesis, and mineral homeostasis, calcium balance, in the body. Bone structure. Bones are composed of bone tissue, osseous tissue, primarily consisting of collagen fibers and calcium phosphate minerals, providing strength, flexibility, and resilience. Bone cells include osteoblasts, bone-forming cells, osteocytes, mature bone cells, and osteoclasts, bone-resorbing cells. Bone classification. Bones are classified based on shape, long, short, flat, irregular, and function, support, protection, movement. Long bones, such as the femur and humerus, are characterized by a shaft, diaphyses, and expanded ends, epiphyses, containing spongy bone and marrow. Bone development, osteogenesis, involves two main processes: intramembranous ossification, where bone forms directly from mesenchymal cells, and endochondral ossification, where bone replaces cartilage templates formed by chondrocytes in fetal development and growth. Bone remodeling. Bone remodeling is a continuous process of resorption, bone breakdown, and formation, bone deposition, mediated by osteoclasts and osteoblasts, respectively. Remodeling maintains bone strength, repairs microdamage, releases mineral stores, and adapts bone to mechanical stress. Bone growth and repair. Bone growth occurs through longitudinal growth at the epiphyseal growth plates, metaphyses, during childhood and adolescence, and appositional growth on bone surfaces throughout life. Bone repair involves inflammation, callus formation, ossification, and remodeling phases after fractures or injuries. Bone health factors. Factors influencing bone health include genetics, nutrition, calcium, vitamin D, protein, physical activity, hormonal regulation, calcitonin, parathyroid hormone, estrogen, age, gender, medications. Bone health factors. Continued chronic diseases, osteoporosis, osteoarthritis, and lifestyle habits, smoking, alcohol consumption. Maintaining optimal bone health requires a balanced diet, regular weight-bearing exercise, adequate sun exposure for vitamin D synthesis, avoidance of tobacco and excessive alcohol intake, and preventive measures against falls and fractures in older adults. Muscular system and movement. Muscle tissue types. The muscular system consists of three types of muscle tissue: skeletal muscle, cardiac muscle, and smooth muscle. Skeletal muscle is attached to bones and responsible for voluntary movement, while cardiac muscle forms the heart and pumps blood, and smooth muscle lines hollow organs and controls involuntary functions. Skeletal muscle structure. Skeletal muscles are composed of muscle fibers, muscle cells, bundled together in fascicles, surrounded by connective tissue layers, epimysium, perimysium, endomysium. Muscle fibers contain myofibrils composed of sarcomeres, the contractile units of muscle, consisting of actin and myosin filaments. Muscle contraction. Muscle contraction involves the sliding filament theory, where myosin heads bind to actin filaments, forming cross bridges that pull actin filaments toward the center of sarcomeres, causing muscle shortening, contraction. Calcium ions released from the sarcoplasmic reticulum trigger muscle contraction by binding to troponin, exposing active sites on actin. Neuromuscular junction. The neuromuscular junction is the synapse between motor neurons and muscle fibers, where neurotransmitter acetylcholine, ACH, is released from motor neuron terminals, binding to ACH receptors on the motor end plate, initiating muscle fiber depolarization and action potential propagation along the sarcolemma. Motor unit activation. Motor units consist of a motor neuron and the muscle fibers it innervates. Motor unit recruitment involves activating motor neurons to generate graded muscle contractions by increasing the number and frequency of action potentials, recruiting more muscle fibers as needed for force production. Muscle fiber types. Skeletal muscle fibers are classified into slow twitch, type I, and fast twitch, type II, fibers based on their contraction speed, metabolic characteristics, and fatigue resistance. Type I fibers are oxidative, fatigue-resistant, and suited for endurance activities, while Type II fibers are glycolytic, fast-contracting, and suited for power and speed activities. Muscle function and movement. Muscles work in coordinated groups to produce movement around joints by contracting concentrically, shortening, eccentrically, lengthening, or isometrically, maintaining tension, to generate force, stabilize joints, control movement speed, and produce smooth and coordinated movements. Cardiovascular system and circulation. Cardiovascular system overview. The cardiovascular system consists of the heart, cardio, and blood vessels, vascular, including arteries, veins, and capillaries, responsible for circulating blood throughout the body to deliver oxygen, nutrients, and hormones, remove waste products, and maintain homeostasis. Heart structure. The heart is a muscular organ composed of 4 chambers, 2 atria, right and left, receiving blood from veins, and 2 ventricles, right and left, pumping blood into arteries. Valves, atrioventricular and semilunar, ensure unidirectional blood flow between chambers and prevent backflow. Cardiac cycle. The cardiac cycle comprises systole, contraction, and diastole, relaxation, phases of the heart chambers, coordinated by electrical signals from the sinoatrial, SA, node, atrioventricular, AV, node, and Purkinje fibers, generating rhythmic heartbeat and blood ejection. Blood vessels. Blood vessels transport blood throughout the body, including arteries carrying oxygen-rich blood away from the heart, veins returning oxygen-poor blood to the heart, and capillaries facilitating gas exchange and nutrient exchange between blood and tissues. Blood pressure regulation. Blood pressure is the force exerted by blood against the walls of blood vessels, regulated by cardiac output, heart rate and stroke volume, and peripheral resistance, vessel diameter and blood viscosity. Baroreceptors in blood vessels and chemoreceptors in the bloodstream help maintain blood pressure within normal limits. Cardiovascular diseases. Cardiovascular diseases, CVDs, encompass a range of conditions affecting the heart and blood vessels, including coronary artery disease, hypertension, heart failure, stroke, peripheral artery disease, and arrhythmias, leading causes of morbidity and mortality worldwide. Cardiovascular health promotion. Promoting cardiovascular health involves adopting heart-healthy lifestyle habits, including regular physical activity, balanced nutrition, weight management, smoking cessation, stress reduction, and regular medical checkups to prevent CVD risk factors, improve heart function, and enhance overall well-being. Respiratory system and gas exchange. Respiratory system overview. The respiratory system consists of organs involved in breathing, including the airways, nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, lungs, alveoli, and respiratory muscles, diaphragm, intercostal muscles, responsible for ventilation and gas exchange. Mechanics of breathing. Breathing involves inspiration, inhalation, and expiration, exhalation, regulated by changes in thoracic cavity volume. During inspiration, the diaphragm contracts and moves downward, while intercostal muscles expand the rib cage, increasing lung volume and decreasing pressure, causing air to flow into the lungs. Expiration occurs passively as the diaphragm and intercostal muscles relax, reducing lung volume and increasing pressure, leading to air expulsion. Gas exchange in alveoli. Gas exchange occurs in alveoli, tiny air sacs in the lungs surrounded by capillaries, where oxygen, O2, diffuses from alveolar air into pulmonary capillaries and carbon dioxide, CO2, diffuses from capillaries into alveoli for elimination during exhalation. This process maintains blood gas homeostasis and facilitates cellular respiration. Respiratory regulation. Respiratory rate and depth are regulated by the respiratory control center in the brainstem, responding to chemical, for example, CO2 levels, neural, for example, respiratory center stimulation, and mechanical, for example, lung stretch receptors, stimuli to adjust breathing patterns and maintain acid-base balance and oxygenation. Respiratory diseases. Respiratory disorders affect lung function and gas exchange, including chronic obstructive pulmonary disease, COPD, asthma, pneumonia, bronchitis, emphysema, and respiratory infections, for example, influenza, tuberculosis, causing symptoms like coughing, wheezing, dyspnea, and reduced exercise tolerance. Pulmonary function testing. Pulmonary function tests, PFTs, assess lung function and respiratory health, including spirometry to measure lung volumes and capacities, peak expiratory flow rate, PFR, lung diffusion capacity, DLCO, and arterial blood gas analysis to evaluate gas exchange efficiency. Respiratory health promotion. Promoting respiratory health involves adopting preventive measures such as avoiding tobacco smoke and environmental pollutants, maintaining indoor air quality, practicing good hygiene, for example, hand washing, covering coughs, receiving vaccinations, for example, influenza, pneumococcal, and seeking medical care for respiratory symptoms to prevent complications and improve respiratory outcomes. Digestive system and nutrition. Digestive system overview. The digestive system comprises organs involved in digestion and nutrient absorption, including the gastrointestinal, GI, tract, mouth, esophagus, stomach, small intestine, large intestine, and accessory organs, salivary glands, liver, gallbladder, pancreas, responsible for breaking down food into nutrients for energy and metabolism. Digestive processes. Digestion involves mechanical and chemical processes. Mechanical digestion includes chewing, mastication, and mixing food by muscular contractions, peristalsis, while chemical digestion involves enzymes breaking down complex nutrients into absorbable molecules, for example, carbohydrates to glucose, proteins to amino acids, fats to fatty acids and glycerol. Nutrient absorption. Nutrient absorption occurs primarily in the small intestine, where villi and microvilli increase surface area for absorption. Nutrients, for example, glucose, amino acids, fatty acids, are transported across the intestinal epithelium into blood capillaries or lymphatic vessels, lacteals, for distribution to cells and tissues. Role of accessory organs. Accessory organs secrete digestive enzymes and fluids to aid digestion and nutrient absorption. The liver produces bile, stored in the gallbladder and released into the small intestine to emulsify fats. The pancreas secretes pancreatic enzymes, amylase, lipase, proteases, and bicarbonate to neutralize stomach acid and digest carbohydrates, fats, and proteins. Gut microbiota. The gut microbiota consists of trillions of microorganisms residing in the GI tract, including bacteria, viruses, fungi, and archaea, playing essential roles in digestion, nutrient metabolism, immune function, and gut-brain communication. A diverse and balanced microbiome is associated with better health outcomes. Dietary guidelines. Dietary guidelines recommend consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting added sugars, sodium, and saturated fats. Adequate hydration and portion control are also emphasized for overall health and well-being. Nutritional assessment. Nutritional assessment evaluates dietary intake, nutritional status, and risk factors for malnutrition or nutrient deficiencies using tools such as dietary recalls, food diaries, anthropometric measurements, height, weight, BMI, biochemical tests, blood lipids, glucose, and clinical evaluations to guide personalized nutrition interventions and promote optimal health outcomes. Certainly, let's continue with the next section. Urinary system and fluid balance. Urinary system overview. The urinary system, also known as the renal system, comprises organs responsible for urine formation, storage, and excretion, including the kidneys, ureters, bladder, and urethra. Its primary functions include filtering waste products from the blood, regulating electrolyte balance, maintaining fluid volume, and controlling blood pressure. Kidney structure and function. The kidneys are bean-shaped organs located in the retroperitoneal space, each consisting of millions of nephrons, the functional units responsible for urine production. Nephrons filter blood to remove waste products and excess substances, for example, urea, creatinine, electrolytes, reabsorb essential nutrients and water, and regulate pH and electrolyte balance. Urine formation. Urine formation involves three main processes: glomerular filtration, tubular reabsorption, and tubular secretion. Glomerular filtration occurs in the renal corpuscle, where blood plasma is filtered through the glomerulus into Bowman's capsule. Tubular reabsorption reclaims filtered substances, for example, glucose, water, sodium, back into the bloodstream, while tubular secretion removes additional waste products and maintains electrolyte balance. Renal blood flow and filtration. Renal blood flow is essential for maintaining kidney function and urine production. The kidneys receive approximately 20% of cardiac output, allowing for efficient filtration of blood plasma to form urine. Glomerular filtration rate, GFR, measures the rate at which blood is filtered by the glomeruli and serves as an indicator of kidney function. Fluid and electrolyte balance. The urinary system plays a crucial role in regulating fluid and electrolyte balance to maintain homeostasis. Electrolytes such as sodium, potassium, chloride, and bicarbonate are filtered, reabsorbed, and excreted by the kidneys to control osmotic pressure, acid-base balance, and cellular function. Hormones like aldosterone, antidiuretic hormone, ADH, and atrial natriuretic peptide, ANP, help regulate renal electrolyte and water excretion. Urinary tract infections, UTIs. Urinary tract infections are common bacterial infections affecting the urinary system, typically caused by Escherichia coli, E. coli, bacteria. UTIs may occur in the bladder, cystitis, urethra, urethritis, or kidneys, pyelonephritis, leading to symptoms such as frequent urination, burning sensation, pelvic pain, and cloudy or foul-smelling urine. Treatment involves antibiotics and supportive measures to relieve symptoms and prevent complications. Renal disorders. Various renal disorders affect kidney function and urinary health, including acute kidney injury, AKI, chronic kidney disease, CKD, kidney stones, nephrolithiasis, glomerulonephritis, polycystic kidney disease, PKD, and renal failure. Management strategies may include medication, dietary modifications, dialysis, or kidney transplantation depending on the underlying cause and severity of the condition. Endocrine system and hormonal regulation. Endocrine system overview. The endocrine system comprises glands and organs that produce and secrete hormones, chemical messengers that regulate physiological processes and maintain homeostasis. Key endocrine glands include the pituitary, thyroid, parathyroid, adrenal, pancreas, and gonads, testes and ovaries, as well as hormone-producing tissues like the hypothalamus and thymus. Hormone synthesis and secretion. Endocrine glands synthesize hormones in response to stimuli such as hormonal signals, neural input, or changes in blood chemistry. Hormones are released into the bloodstream and transported to target tissues or organs, where they exert their effects by binding to specific receptors and modulating cellular activity. Pituitary gland. The pituitary gland, often called the master gland, regulates hormone secretion and physiological functions through the production of various hormones, including growth hormone, GH, thyroid-stimulating hormone, TSH, adrenocorticotropic hormone, ACTH, follicle-stimulating hormone, FSH, luteinizing hormone, LH, prolactin, and antidiuretic hormone, ADH. Thyroid gland. The thyroid gland produces thyroid hormones, primarily thyroxine, T4, and triiodothyronine, T3, which regulate metabolism, growth, and development. Thyroid function is controlled by thyroid-stimulating hormone, TSH, from the pituitary gland and influenced by factors such as iodine intake, stress, and environmental factors. Adrenal glands. The adrenal glands produce steroid hormones, cortisol, aldosterone, and catecholamines, epinephrine, norepinephrine, involved in stress response, energy metabolism, electrolyte balance, and blood pressure regulation. The hypothalamic pituitary adrenal, HPA, axis regulates adrenal hormone secretion in response to stressors. Pancreatic hormones. The pancreas secretes insulin, glucagon, and somatostatin to regulate blood glucose levels and metabolism. Insulin lowers blood glucose by promoting glucose uptake by cells, while glucagon raises blood glucose by stimulating glycogen breakdown in the liver. Imbalances in pancreatic hormone secretion contribute to diabetes mellitus and metabolic disorders. Reproductive hormones. The reproductive system produces hormones such as estrogen, progesterone, and testosterone, which regulate reproductive function, secondary sexual characteristics, and fertility. Hormonal fluctuations during the menstrual cycle, pregnancy, and menopause influence reproductive health and overall well-being in males and females. Certainly, let's proceed with the continuation. Reproductive system and sexual health. Reproductive system overview. The reproductive system consists of organs and structures responsible for sexual reproduction and the production of gametes, sperm and eggs. In males, the reproductive system includes the testes, epididymis, vas deferens, seminal vesicles, prostate gland, and penis. In females, it comprises the ovaries, fallopian tubes, uterus, cervix, vagina, and external genitalia. Male reproductive anatomy and physiology. The male reproductive system produces and delivers sperm for fertilization. Spermatogenesis occurs in the seminiferous tubules of the testes, where spermatogonia undergo mitosis and meiosis to produce mature sperm cells. Sperm are stored and matured in the epididymis before being transported through the vas deferens during ejaculation. Female reproductive anatomy and physiology. The female reproductive system supports the development and release of eggs for fertilization and provides an environment for embryonic development. Oogenesis occurs in the ovaries, where oogonia develop into mature ova, eggs, through meiosis. The menstrual cycle, controlled by hormonal fluctuations, prepares the uterus for potential embryo implantation. Sexual development and puberty. Puberty is the period of sexual maturation characterized by hormonal changes and physical development. In males, puberty is marked by testicular enlargement, increased testosterone production, growth of facial and body hair, and deepening of the voice. In females, it involves breast development, menstruation, and changes in body composition. Reproductive health and wellness. Reproductive health encompasses the physical, emotional, and social aspects of sexual well-being, including contraception, family planning, sexually transmitted infection, STI, prevention, and reproductive rights. Access to comprehensive sexual health education, healthcare services, and contraception options promotes reproductive autonomy and reduces adverse outcomes. Common reproductive disorders. Various reproductive disorders affect fertility, sexual function, and reproductive health in both males and females. Examples include infertility, polycystic ovary syndrome, PCOS, endometriosis, uterine fibroids, erectile dysfunction, and sexually transmitted infections, STIs, such as chlamydia, gonorrhea, and human papillomavirus, HPV. Reproductive medicine and assisted reproductive technologies. Reproductive medicine encompasses medical interventions aimed at overcoming infertility and reproductive challenges. Assisted reproductive technologies, ART, including in vitro fertilization, IVF, intracytoplasmic sperm injection, ICSI, and egg or sperm donation, offer options for individuals or couples experiencing difficulties conceiving naturally. Advanced dissection videos and 3D anatomical models. Anatomical dissection videos. Anatomical dissection videos provide detailed demonstrations of anatomical structures, organ systems, and physiological processes through cadaver dissections and surgical procedures. These videos offer valuable insights into human anatomy and clinical anatomy practices for medical education and training purposes. 3D anatomical models. Three-dimensional, 3D, anatomical models are digital representations of anatomical structures created using advanced imaging techniques such as computed tomography, CT, scans, magnetic resonance imaging, MRI, and 3D reconstruction software. These models allow for interactive exploration of anatomical relationships, spatial orientation, and anatomical variations, enhancing learning and visualization in medical education. Clinical case studies and diagnostic imaging interpretations. Clinical case studies present real-life patient scenarios, medical histories, and diagnostic findings to illustrate the application of medical knowledge, diagnostic reasoning, and clinical decision-making in healthcare practice. Diagnostic imaging interpretations involve the analysis and interpretation of medical imaging studies, for example, X-rays, CT scans, MRI, to diagnose and manage medical conditions. Histological slides and microscopy images with detailed annotations. Histological slides and microscopy images provide microscopic views of tissue specimens and cellular structures, allowing for the study of histology, tissue anatomy, and cell biology. Detailed annotations highlight key features, cell types, and pathological changes, aiding in the understanding of normal and abnormal tissue morphology. Terabytes of high-resolution medical imaging datasets for pathology and anatomy studies. 1 TB high-resolution medical imaging datasets comprise vast collections of medical images, including X-rays, CT scans, MRI scans, ultrasound images, and histological slides, stored in digital formats. These datasets serve as valuable resources for research, education, clinical training, and medical imaging analysis, facilitating the study of pathology, anatomy, and medical imaging modalities. Module 12, Mental Health and Psychology. Introduction to Mental Health and Psychology. Mental health overview. Mental health refers to emotional, psychological, and social well-being, encompassing factors such as mood, behavior, and cognition. It influences how individuals think, feel, and interact with others, contributing to overall quality of life and functioning. Psychology defined. Psychology is the scientific study of behavior and mental processes, including thoughts, feelings, and actions. It explores various aspects of human behavior, such as perception, cognition, emotion, motivation, development, and interpersonal relationships. Psychological theories and approaches. Psychoanalytic theory, founded by Sigmund Freud. Psychoanalytic theory emphasizes unconscious processes, childhood experiences, and the role of defense mechanisms in shaping behavior. Behaviorism. Behaviorism focuses on observable behaviors, reinforcement, and conditioning processes, proposing that behavior is learned through environmental stimuli and responses. Cognitive psychology. Cognitive psychology examines mental processes such as perception, memory, reasoning, and problem solving, emphasizing information processing and cognitive schemas. Humanistic psychology. Humanistic psychology emphasizes human potential, self-actualization, and personal growth, highlighting the importance of subjective experiences and self-awareness. Biological psychology. Biological psychology investigates the physiological mechanisms underlying behavior and mental processes, including genetics, neurochemistry, and brain function. Socio-cultural perspective. The socio-cultural perspective considers the influence of cultural, social, and environmental factors on behavior, cognition, and identity. Evolutionary psychology. Evolutionary psychology explores how evolutionary principles shape human behavior, adaptation, and reproductive strategies. Cognitive behavioral therapy, CBT, and psychotherapy. Cognitive behavioral therapy, CBT. CBT is a structured therapeutic approach that aims to identify and modify negative thought patterns and behaviors contributing to psychological distress. It combines cognitive restructuring techniques with behavioral interventions to promote adaptive coping skills and symptom reduction. Psychotherapy. Psychotherapy encompasses various therapeutic modalities, including psychodynamic therapy, humanistic therapy, and interpersonal therapy, tailored to address specific mental health concerns and promote emotional well-being. Mood disorders and anxiety disorders. Mood disorders. Mood disorders involve disturbances in mood regulation, leading to persistent feelings of depression, major depressive disorder, or elevated mood, bipolar disorder. Symptoms may include sadness, hopelessness, loss of interest, and changes in energy and appetite. Anxiety disorders. Anxiety disorders are characterized by excessive worry, fear, and apprehension, interfering with daily functioning and causing distress. Common anxiety disorders include generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and phobias. Psychosomatic disorders and somatoform disorders. Psychosomatic disorders. Psychosomatic disorders involve physical symptoms or illnesses that are influenced by psychological factors such as stress, emotions, and beliefs. Examples include irritable bowel syndrome, IBS, tension headaches, and fibromyalgia. Somatoform disorders. Somatoform disorders are characterized by physical symptoms or complaints that cannot be fully explained by medical conditions, leading to distress and impairment. Conditions include somatization disorder, conversion disorder, and hypochondriasis. Personality disorders and psychological testing. Personality disorders. Personality disorders are enduring patterns of behavior, cognition, and interpersonal functioning that deviate from cultural norms and cause distress or impairment. Examples include borderline personality disorder, narcissistic personality disorder, and obsessive-compulsive personality disorder. Psychological testing. Psychological testing encompasses standardized assessments and measures used to evaluate cognitive abilities, personality traits, emotional functioning, and psychopathology. Tests may include intelligence tests, personality inventories, and diagnostic interviews. Substance use disorders and addiction. Substance use disorders overview. Substance use disorders involve the problematic use of alcohol, drugs, or other substances, leading to addiction, dependence, and negative consequences. They are characterized by impaired control, cravings, tolerance, and withdrawal symptoms. Types of substances. Substances commonly associated with addiction include alcohol, nicotine, opioids, stimulants, for example, cocaine, amphetamines, sedatives, for example, benzodiazepines, hallucinogens, for example, LSD, MDMA, and cannabis. Addiction cycle. Addiction involves a cycle of craving, use, reinforcement, and negative consequences, perpetuated by neurobiological changes in the brain's reward pathways. Dopamine, a neurotransmitter associated with pleasure and reward, plays a central role in addiction. Risk factors for addiction. Risk factors for developing substance use disorders include genetic predisposition, environmental influences, for example, peer pressure, trauma, co-occurring mental health disorders, for example, depression, anxiety, and socio-cultural factors, for example, socioeconomic status, access to substances. Effects of addiction. Addiction can have profound physical, psychological, and social consequences, impacting physical health, mental well-being, relationships, employment, and legal status. Chronic substance abuse can lead to organ damage, cognitive impairment, psychiatric disorders, and increased risk of accidents and injuries. Treatment approaches for addiction. Treatment for addiction typically involves a combination of pharmacotherapy, psychotherapy, behavioral interventions, and support services. Common approaches include detoxification, medication-assisted treatment, for example, methadone, buprenorphine, counseling, for example, cognitive behavioral therapy, motivational interviewing, support groups, for example, Alcoholics Anonymous, Narcotics Anonymous, and relapse prevention strategies. Recovery and relapse prevention. Recovery from addiction is a lifelong process characterized by abstinence, self-awareness, personal growth, and social support. Relapse prevention strategies focus on identifying triggers, developing coping skills, building resilience, and maintaining a healthy lifestyle to prevent relapse and sustain long-term sobriety. Trauma and post-traumatic stress disorder, PTSD. Trauma defined. Trauma refers to an emotional or psychological response to a distressing or disturbing event, such as violence, abuse, natural disasters, accidents, or military combat. Traumatic experiences can overwhelm an individual's ability to cope and lead to lasting psychological effects. Post-traumatic stress disorder, PTSD. PTSD is a mental health condition that can develop after experiencing or witnessing a traumatic event. Symptoms may include intrusive memories, flashbacks, nightmares, hypervigilance, avoidance of trauma reminders, negative mood changes, and alterations in arousal and reactivity. Diagnostic criteria for PTSD. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, PTSD is diagnosed when an individual exhibits specific symptoms related to trauma exposure for at least 1 month, causing significant distress or impairment in social, occupational, or other areas of functioning. Risk factors for PTSD. Risk factors for developing PTSD include the severity and duration of trauma exposure. Personal vulnerability factors, for example, prior trauma, mental health history, lack of social support, and environmental stresses, for example, ongoing adversity, limited resources. Biological and psychological mechanisms. PTSD is associated with alterations in neurobiological systems involved in stress response, emotion regulation, and memory consolidation. Dysregulation of neurotransmitters, for example, serotonin, norepinephrine, hormonal imbalances, for example, cortisol, and changes in brain structure and function, for example, hippocampus, amygdala, prefrontal cortex, may contribute to PTSD symptoms. Psychological factors, such as cognitive appraisals of the trauma, coping strategies, and social support, also influence the development and maintenance of PTSD. Treatment for PTSD. Psychotherapy. Evidence-based psychotherapeutic approaches for PTSD include cognitive processing therapy, CAPTIN, prolonged exposure therapy, PEI, eye movement desensitization and reprocessing, EMDR, and trauma-focused cognitive behavioral therapy, TFCBT. These therapies aim to process traumatic memories, modify maladaptive beliefs, and reduce avoidance behaviors. Medication, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed medications for PTSD. They may help alleviate symptoms of depression, anxiety, and intrusive thoughts. Complementary and alternative treatments. Complementary approaches such as yoga, mindfulness meditation, acupuncture, and equine therapy may supplement traditional PTSD treatments and promote relaxation, emotional regulation, and stress reduction. Supportive interventions. Supportive interventions, including peer support groups, trauma-informed care, and social services, can provide validation, normalization, and practical assistance to individuals with PTSD. Self-care strategies. Self-care practices such as regular exercise, healthy nutrition, adequate sleep, and leisure activities can support overall well-being and resilience in coping with PTSD symptoms. Prevention and early intervention. Primary prevention. Primary prevention efforts aim to reduce the incidence of trauma exposure and mitigate risk factors associated with PTSD. Strategies include community education, violence prevention programs, workplace safety initiatives, and disaster preparedness training. Secondary prevention. Secondary prevention focuses on early detection and intervention to prevent the onset of PTSD or minimize its severity following trauma exposure. Screening programs, crisis intervention services, and mental health first aid training can facilitate early identification and support. Tertiary prevention. Tertiary prevention involves providing specialized treatment and support services to individuals already diagnosed with PTSD to prevent chronicity, disability, and functional impairment. Comprehensive care coordination, case management, and rehabilitation programs are integral components of tertiary prevention efforts. Child psychology and developmental disorders. Child psychology overview. Child psychology is the study of psychological development from infancy through adolescence, encompassing cognitive, emotional, social, and behavioral aspects of growth and maturation. Developmental stages. Developmental psychology identifies key milestones and stages of development, including infancy, early childhood, middle childhood, adolescence, and emerging adulthood. Each stage is characterized by unique challenges, achievements, and transitions in physical, cognitive, and socio-emotional domains. Theoretical perspectives. Theoretical perspectives in child psychology include psychoanalytic theory. Freudian and neo-Freudian perspectives emphasize the role of unconscious conflicts, early experiences, and psychosocial stages in shaping personality development. Cognitive developmental theory. Piaget's theory focuses on cognitive development and the progressive acquisition of mental schemas, operational thinking, and problem-solving skills. Social learning theory. Bandura's theory emphasizes observational learning, social reinforcement, and modeling in children's acquisition of behaviors, attitudes, and values. Attachment theory. Bowlby's attachment theory explores the formation of secure attachments between infants and caregivers, influencing emotional regulation, trust, and social relationships. Ecological systems theory. Bronfenbrenner's ecological systems theory considers the influence of environmental contexts, such as family, school, peers, and community, on child development and functioning. Developmental milestones. Developmental milestones are specific skills, behaviors, and abilities that children typically achieve at certain ages. Milestones include motor development, for example, sitting, crawling, walking, language development, for example, babbling, first words, sentence formation, social development, for example, smiling, making eye contact, sharing, and cognitive development, for example, object permanence, symbolic play, problem solving. Common developmental disorders. Developmental disorders are neurodevelopmental conditions characterized by impairments in physical, cognitive, communication, social, or adaptive functioning. Common developmental disorders include autism spectrum disorder, ASD. ASD is a complex developmental disorder characterized by persistent deficits in social communication and interaction, restricted interests, repetitive behaviors, and sensory sensitivities. Attention deficit / hyperactivity disorder, ADHD. ADHD is a neurodevelopmental disorder characterized by inattention, hyperactivity, impulsivity, and difficulty with executive functions such as organization, planning, and self-regulation. Intellectual disability. IDID is a condition characterized by limitations in intellectual functioning and adaptive behavior, affecting conceptual, social, and practical skills necessary for daily living. Specific learning disorders. Specific learning disorders involve difficulties in acquiring and using academic skills, such as reading, dyslexia, writing, dysgraphia, and mathematics, dyscalculia, despite adequate intelligence and educational opportunities. Communication disorders. Communication disorders encompass speech disorders, for example, stuttering, articulation disorders, and language disorders, for example, expressive language disorder, receptive language disorder, that impair verbal and nonverbal communication abilities. Assessment and diagnosis. Assessment of developmental disorders involves comprehensive evaluations by multidisciplinary teams, including pediatricians, psychologists, educators, and speech-language pathologists. Diagnostic tools may include standardized assessments, behavioral observations, developmental screenings, medical evaluations, and parent or teacher reports. Intervention and support services. Early intervention services play a critical role in promoting optimal development and addressing the needs of children with developmental disorders. Interventions may include behavioral interventions, applied behavior analysis, ABA, behavioral therapy, and social skills training target specific behaviors and functional skills to improve adaptive functioning and reduce maladaptive behaviors. Educational interventions, individualized education plans, IEPs, special education services, and classroom accommodations facilitate academic progress and address learning challenges in school settings. Therapeutic interventions, speech therapy, occupational therapy, physical therapy, and play therapy address communication deficits, sensory processing difficulties, motor coordination problems, and emotional regulation issues. Family support services, family-centered interventions provide education, counseling, and support to parents and caregivers, promoting positive parent-child interactions, coping strategies, and access to community resources. Aging and geriatric psychology. Aging process overview. Aging is a natural and inevitable process characterized by biological, psychological, and social changes that occur over the lifespan. As individuals age, they experience declines in physical health, sensory functions, cognitive abilities, and social roles, as well as gains in wisdom, resilience, and life satisfaction. Biological changes. Biological changes associated with aging include cellular aging. Cellular aging involves progressive deterioration of cellular structures and functions, leading to reduced repair mechanisms, oxidative stress, and DNA damage. Organ system changes. Organ systems undergo age-related changes, including decreased cardiovascular efficiency, diminished respiratory capacity, impaired immune function, and alterations in hormonal regulation. Neurological changes. Neurological changes in aging include cortical thinning, neuronal loss, neurotransmitter imbalances, and white matter lesions, contributing to cognitive decline, memory impairment, and sensory deficits. Psychological changes. Psychological changes associated with aging include cognitive decline. Aging is often accompanied by declines in cognitive functions such as processing speed, working memory, executive function, and attention. While some cognitive changes are typical of normal aging, others may indicate underlying neurodegenerative conditions such as Alzheimer's disease. Emotional regulation. Older adults may experience changes in emotional regulation, including increased emotional stability, greater emotional resilience, and a focus on positive emotions. However, some individuals may also be at risk for mood disorders such as depression or anxiety. Personality development. Personality traits tend to be relatively stable across the lifespan, but certain changes may occur with age, such as increased conscientiousness, agreeableness, and emotional maturity. Personality changes may also be influenced by life transitions, health events, and social factors. Social relationships. Aging is associated with changes in social relationships, including shifts in family dynamics, retirement, relocation, and loss of social networks. Maintaining social connections and engagement is essential for emotional well-being and mental health in older adults. Geriatric psychology and mental health. Common mental health concerns. Geriatric psychology focuses on addressing mental health issues and improving psychological well-being in older adults. Common mental health concerns in older adults include depression, anxiety, cognitive impairment, substance abuse, and adjustment disorders. Late-onset psychiatric disorders. Late-life psychiatric disorders may emerge in older adults due to biological, psychological, and social factors. Conditions such as late-onset depression, late-life anxiety disorders, and late-onset psychosis require specialized assessment and treatment approaches. Dementia and neurocognitive disorders. Dementia is a progressive neurocognitive disorder characterized by cognitive decline, memory impairment, and functional decline, affecting daily activities and independence. Alzheimer's disease. vascular dementia, Lewy body dementia, and frontotemporal dementia are common types of dementia in older adults. Assessment and diagnosis. Comprehensive geriatric assessments evaluate cognitive, emotional, physical, and social functioning to identify mental health needs and formulate individualized treatment plans. Assessment tools may include cognitive screening tests, depression scales, functional assessments, and caregiver interviews. Treatment approaches. Treatment for mental health issues in older adults may involve a combination of pharmacotherapy, psychotherapy, behavioral interventions, and psychosocial support. Interventions aim to alleviate symptoms, improve quality of life, and enhance functional capacity while considering the unique needs and preferences of older adults. Caregiver support. Caregivers of older adults play a vital role in providing emotional support, practical assistance, and advocacy for individuals with mental health concerns. Caregiver support programs offer education, respite services, and resources to help caregivers cope with the demands of caregiving and maintain their own well-being. Successful aging and well-being. Successful aging paradigm. Successful aging refers to the ability to maintain physical health, cognitive function, social engagement, and emotional well-being in later life. It emphasizes adaptive coping strategies, resilience, and positive aging attitudes. Factors contributing to successful aging. Factors associated with successful aging include physical health, maintaining a healthy lifestyle, managing chronic conditions, and accessing preventive healthcare services promote physical well-being and longevity. Cognitive engagement, engaging in mentally stimulating activities, lifelong learning, and cognitive training exercises can preserve cognitive function and reduce the risk of cognitive decline. Social connectedness, building and maintaining social relationships, participating in community activities, and volunteering enhance social support networks and combat social isolation. Emotional resilience, cultivating emotional resilience, positive coping skills, and adaptive strategies for managing stresses and life transitions fosters emotional well-being and psychological adjustment. End-of-life care and palliative psychology. End-of-life care. End-of-life care focuses on providing comfort, dignity, and quality of life for individuals with advanced illness or nearing the end of life. Palliative care, hospice care, and advanced care planning support patients and families in making informed decisions about medical treatments, symptom management, and end-of-life preferences. Psychological support. Palliative psychologists offer psychological support, counseling, and therapeutic interventions to patients, families, and caregivers facing serious illness, grief, loss, and existential concerns. Psychotherapy, grief counseling, and existential therapy address emotional distress, spiritual needs, and existential questions related to life and death. Bereavement support. Bereavement support services provide compassionate care and resources to individuals coping with the loss of a loved one. Grief support groups, individual counseling, memorial services, and community-based programs offer validation, comfort, and companionship during the grieving process. Research and innovations in geriatric psychology. Age-friendly environments. Age-friendly initiatives promote inclusive communities, accessible environments, and supportive services for older adults, enhancing their quality of life, independence, and social participation. Technology and aging. Technology innovations such as telehealth, remote monitoring, smart home devices, and assistive technologies facilitate aging in place, remote healthcare delivery, and social connectivity for older adults. Positive aging interventions. Positive psychology interventions, Mindfulness-based programs, reminiscence therapy, and life review activities promote resilience, gratitude, and life satisfaction in older adults. To cognitive decline, memory deficits, and changes in sensory perception. Psychological changes. Psychological changes associated with aging include cognitive changes. Aging may be accompanied by declines in cognitive abilities such as processing speed, working memory, attention, and executive function. However, wisdom, knowledge, and crystallized intelligence often remain intact or even improve with age. Emotional changes. Older adults may experience changes in emotional regulation, resilience, and coping strategies, leading to greater emotional stability and satisfaction in later life. However, they may also face challenges such as grief, loneliness, and depression, especially in the context of losses and life transitions. Social changes. Social networks may change with age due to retirement, relocation, and changes in family dynamics. Older adults may experience increased social isolation, but they also have opportunities for new social connections, leisure activities, and community engagement. Healthy aging and successful aging. Healthy aging involves maintaining physical health, mental well-being, and social engagement throughout the aging process. Successful aging goes beyond the absence of disease and disability to encompass active participation in life, fulfillment of personal goals, and adaptation to age-related changes. Common geriatric syndromes. Geriatric syndromes are multifactorial conditions prevalent in older adults, often involving interactions between medical, functional, psychological, and social factors. Examples include falls and frailty. Falls and frailty are common geriatric syndromes characterized by increased vulnerability to adverse health outcomes, functional decline, and mortality. Risk factors include age-related changes in balance, mobility, muscle strength, and cognition. Delirium. Delirium is an acute and fluctuating disturbance in attention, cognition, and consciousness, often triggered by medical illness, surgery, medications, or environmental factors. Delirium is a medical emergency requiring prompt evaluation and management. Polypharmacy. Polypharmacy refers to the concurrent use of multiple medications by older adults, increasing the risk of adverse drug reactions, drug interactions, medication errors, and non-adherence. Rational prescribing, medication review, and deprescribing strategies are essential to optimize medication use in older adults. Long-term care and aging in place. Long-term care encompasses a range of services and supports designed to meet the needs of older adults with functional limitations, chronic illnesses, or cognitive impairments. Long-term care options include nursing homes. Nursing homes provide 24-hour skilled nursing care, rehabilitation services, and assistance with activities of daily living for residents with complex medical needs. Assisted living facilities. Assisted living facilities offer supportive housing, personal care services, and social activities for older adults who require assistance with activities of daily living but do not need round-the-clock medical supervision. Home care services. Home care services allow older adults to receive assistance with personal care, household tasks, medication management, and medical monitoring in their own homes, promoting independence and aging in place. Psychological well-being in older adults. Psychological well-being in older adults is influenced by various factors, including resilience. Resilience refers to the ability to adapt to adversity, cope with stressors, and maintain psychological well-being in the face of challenges or losses. Resilient older adults demonstrate flexibility, optimism, social support, and problem-solving skills. Meaningful activities. engagement in meaningful activities such as hobbies, volunteer work, social groups, and lifelong learning promotes cognitive stimulation, social connection, and a sense of purpose in later life. Social support from family, friends, and community networks buffers against loneliness, depression, and isolation in older adults. Strong social ties, reciprocal relationships, and emotional bonds foster resilience and well-being. Advanced psychological assessments and diagnostic tools. Psychological assessment overview. Psychological assessment involves the systematic evaluation of an individual's cognitive, emotional, behavioral, and personality functioning to inform diagnosis, treatment planning, and intervention. Types of psychological assessments. Psychological assessments encompass various types of tests, measures, and instruments, including clinical interviews. Clinical interviews involve structured or semi-structured conversations between clinicians and clients to gather information about presenting problems, symptoms, history, and psychosocial factors. Standardized tests. Standardized tests are formal assessments with established norms and reliability, designed to measure specific constructs such as intelligence, for example, IQ tests, personality, for example, MMPI, cognitive abilities, for example, WAIS, and mental health symptoms, for example, Beck Depression Inventory. Behavioral observations. Behavioral observations involve systematic observations of an individual's behavior in naturalistic or controlled settings to assess functioning, interactions, and symptoms. Self-report inventories. Self-report inventories are questionnaires or checklists completed by individuals to assess subjective experiences, attitudes, beliefs, and symptoms related to mental health, personality, and well-being. Diagnostic tools in psychology. Diagnostic tools assist clinicians in formulating diagnoses based on standardized criteria outlined in diagnostic manuals such as the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, or the International Classification of Diseases, ICD-10. Diagnostic tools include structured interviews, symptom checklists, rating scales, and diagnostic algorithms. Module 13, Disease Prevention and Management. Introduction to Disease Prevention and Management. Disease Prevention Overview. Disease prevention encompasses strategies and interventions aimed at reducing the incidence, prevalence, and impact of illnesses and health conditions within populations. It involves promoting health, preventing diseases, and optimizing well-being through proactive measures and public health initiatives. Disease management defined. Disease management involves the coordinated efforts of healthcare providers, patients, and caregivers to optimize care, control symptoms, and improve outcomes for individuals living with chronic or complex health conditions. It emphasizes comprehensive, patient-centered approaches that integrate medical, behavioral, and social interventions. Primary, secondary, and tertiary prevention. Primary prevention. Primary prevention focuses on preventing the onset of diseases and conditions before they occur. Strategies may include health education, vaccination, environmental modifications, and lifestyle interventions aimed at reducing risk factors and promoting protective factors for health. Secondary prevention. Secondary prevention involves early detection, screening, and intervention to identify and treat diseases in their early stages, preventing progression and complications. Examples include cancer screenings, cholesterol tests, and blood pressure monitoring. Tertiary prevention. Tertiary prevention aims to minimize the impact of diseases and disabilities, prevent complications, and improve quality of life for individuals with existing health conditions. It includes rehabilitation, disease management programs, palliative care, and supportive services. Population-based versus individual approaches. Disease prevention and management strategies can be implemented at both population and individual levels. Population-based approaches. Population-based approaches target entire populations or specific groups within communities, aiming to address underlying determinants of health, promote healthy behaviors, and create supportive environments for health. Individual approaches. Individual approaches focus on personalized care, risk assessment, and treatment tailored to the needs of individual patients. They involve clinical interventions, patient education, self-management support, and shared decision-making between healthcare providers and patients. Epidemiology and disease surveillance. Epidemiology overview. Epidemiology is the study of the distribution and determinants of health-related events, diseases, and conditions within populations, as well as the application of this knowledge to control and prevent health problems. Epidemiologists investigate patterns of disease occurrence, identify risk factors, and evaluate interventions to improve public health. Key concepts in epidemiology. Disease occurrence. Disease occurrence refers to the frequency and distribution of diseases or health-related events within populations, including measures such as incidence, prevalence, and mortality rates. Determinants of health. Determinants of health are factors that influence the risk of disease and health outcomes, including biological, environmental, behavioral, and social determinants. Examples include genetics, lifestyle behaviors, socioeconomic status, and access to healthcare. Epidemiological triad. The epidemiological triad model conceptualizes disease causation as the interaction between the host, for example, individual, agent, for example, pathogen, and environment, for example, physical, social, factors. Understanding these interactions helps identify opportunities for disease prevention and control. Descriptive versus analytical epidemiology. Descriptive epidemiology focuses on characterizing patterns of disease occurrence, such as time trends, geographic distributions, and demographic patterns. Analytical epidemiology examines associations between exposures and outcomes to identify risk factors, causal relationships, and preventive strategies. Disease surveillance systems. Disease surveillance involves ongoing, systematic collection, analysis, and interpretation of health data to monitor disease trends, detect outbreaks, and inform public health interventions. Surveillance systems may include notifiable disease reporting. Healthcare providers and laboratories report cases of specific diseases mandated by public health authorities, enabling early detection and response to infectious disease outbreaks. Syndromic surveillance. Syndromic surveillance monitors real-time data on symptoms and clinical presentations from healthcare facilities, emergency departments, or other sources to detect patterns indicative of emerging diseases or bioterrorism events. Surveillance networks. Surveillance networks coordinate data collection and sharing among local, state, national, and international agencies, facilitating collaborative efforts to monitor and control diseases across borders. Role of epidemiology in public health. Disease prevention. Epidemiology informs strategies for disease prevention, health promotion, and risk reduction by identifying modifiable risk factors, high-risk populations, and effective interventions. Outbreak investigation. Epidemiologists investigate outbreaks of infectious diseases or other health threats to identify sources, modes of transmission, and contributing factors, guiding containment measures and preventive actions. Policy development. Epidemiological evidence informs public health policies, guidelines, and regulations related to disease control, vaccination programs, environmental health, and healthcare delivery systems. Health equity. Epidemiology addresses health disparities and inequalities by examining social determinants of health, advocating for equitable access to healthcare, and addressing root causes of health inequities within populations. Immunology and vaccination. 1. Be administered through various routes, including intramuscular injection, subcutaneous injection, oral ingestion, intranasal spray, and intradermal injection. The choice of administration route depends on the vaccine type, age of the recipient, and desired immune response. Importance of vaccination. Disease prevention. Vaccination is one of the most effective strategies for preventing infectious diseases and their complications, reducing morbidity, mortality, and healthcare costs associated with vaccine-preventable illnesses. Herd immunity. Vaccination contributes to herd immunity by reducing the transmission of pathogens within communities, protecting vulnerable individuals who cannot be vaccinated due to medical reasons or contraindications. Eradication and control. Vaccination programs have led to the eradication of smallpox, near elimination of diseases such as polio and measles in certain regions, and control of other infectious diseases worldwide. Vaccine safety and efficacy. Safety monitoring. Vaccine safety monitoring involves ongoing surveillance of adverse events following immunization, AEFI, through systems such as the Vaccine Adverse Event Reporting System, VAES, and Vaccine Safety Data Link, VSD. Regulatory agencies and expert committees assess vaccine safety data to ensure the continued safety of vaccines. Efficacy assessment. Vaccine efficacy is evaluated through clinical trials, observational studies, and real-world effectiveness studies to measure the reduction in disease incidence among vaccinated individuals compared to unvaccinated or placebo groups. Efficacy may vary depending on factors such as vaccine type, population characteristics, and disease prevalence. Challenges and controversies. Vaccine hesitancy. Vaccine hesitancy refers to the reluctance or refusal to vaccinate despite the availability of vaccines, often due to concerns about safety, efficacy, religious or philosophical beliefs, misinformation, or distrust of authorities. Misinformation and myths. Misinformation and myths about vaccines contribute to vaccine hesitancy and pose challenges to public health efforts. Debunking myths, providing accurate information, and addressing concerns through education and communication campaigns are essential to build trust and confidence in vaccines. Ethical considerations. Ethical considerations in vaccination include issues such as informed consent, autonomy, equity, and justice. Ensuring equitable access to vaccines, addressing disparities in vaccination coverage, and respecting cultural beliefs and preferences are important ethical principles in vaccination programs. Infectious diseases and antimicrobial resistance. Infectious diseases overview. Infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, fungi, parasites, and prions. They can be transmitted from person to person, through contaminated food or water, insect vectors, or environmental sources. Transmission modes. Infectious diseases can be transmitted through various modes, including direct contact with infected individuals, bodily fluids, or contaminated surfaces can transmit pathogens causing diseases such as influenza, tuberculosis, and sexually transmitted infections, STIs. Airborne transmission. Airborne transmission occurs when infectious agents are suspended in the air and inhaled or deposited on mucous membranes, leading to respiratory infections such as COVID-19, measles, and tuberculosis. Vector-borne transmission. Vector-borne diseases are transmitted through arthropod vectors such as mosquitoes, ticks, and fleas. Examples include malaria, dengue fever, Lyme disease, and Zika virus. Waterborne transmission. Waterborne diseases are transmitted through contaminated water sources, leading to gastrointestinal infections such as cholera, typhoid fever, and hepatitis A. Foodborne transmission. Foodborne diseases result from consuming contaminated food or beverages contaminated with bacteria, viruses, parasites, or toxins. Common pathogens include Salmonella, E. coli, norovirus, and Listeria. Antimicrobial resistance, AMR. Definition: antimicrobial resistance refers to the ability of microorganisms to withstand the effects of antimicrobial drugs, rendering them ineffective in treating infections. AMR poses a global health threat, compromising the effectiveness of antibiotics, antivirals, antifungals, and antiparasitic drugs. Mechanisms of resistance. Microorganisms develop resistance through mechanisms such as genetic mutations, horizontal gene transfer, and selection pressure from antimicrobial use. Common mechanisms include the production of enzymes that degrade antibiotics, alteration of drug targets, and efflux pumps that expel drugs from cells. Consequences of AMR. AMR leads to increased morbidity, mortality, healthcare costs, and treatment failures due to the limited availability of effective antibiotics. It complicates the management of infectious diseases, surgical procedures, and immunocompromised patients, posing challenges to public health and clinical practice. Factors contributing to AMR. Factors contributing to AMR include overuse and misuse of antibiotics in human and veterinary medicine, inadequate infection control practices, lack of access to clean water and sanitation, globalization of travel and trade, and agricultural practices such as antibiotic use in livestock production. Strategies to combat AMR. Strategies to combat AMR include antibiotic stewardship. Antibiotic stewardship programs promote judicious antibiotic use, adherence to prescribing guidelines, and surveillance of antibiotic resistance patterns to optimize patient outcomes and minimize resistance. Infection prevention and control. Infection prevention and control measures, including hand hygiene, environmental cleaning, isolation precautions, and vaccination, reduce the transmission of resistant pathogens in healthcare settings and the community. Research and development. Research and development efforts focus on developing new antibiotics, alternative treatment modalities, for example, phage therapy, monoclonal antibodies, and vaccines to combat drug-resistant infections and address unmet medical needs. Global collaboration. Global collaboration and multisectoral partnerships are essential to address AMR at national, regional, and international levels. Initiatives such as the Global Action Plan on AMR, the WHO Global Antimicrobial Resistance Surveillance System, GLASS, and the Tripartite Collaboration, WHO, FAO, OIE, promote coordinated action to tackle AMR. One Health Approach. The One Health approach recognizes the interconnectedness of human health, animal health, and environmental health in the emergence, transmission, and spread of infectious diseases and AMR. It emphasizes collaboration across sectors, disciplines, and stakeholders to address complex health challenges and promote sustainable solutions. Chronic diseases and lifestyle interventions. Chronic diseases overview. Chronic diseases are long-term medical conditions characterized by persistent or recurring symptoms, functional limitations, and the need for ongoing management and care. Common chronic diseases include cardiovascular diseases, diabetes, cancer, chronic respiratory diseases, and mental health disorders. Risk factors for chronic diseases. Behavioral risk factors. Behavioral risk factors such as unhealthy diet, physical inactivity, tobacco use, excessive alcohol consumption, and substance abuse contribute to the development of chronic diseases such as obesity, hypertension, type 2 diabetes, and cardiovascular disease. Biological risk factors. Biological risk factors include genetic predisposition, age, sex, hormonal factors, and underlying medical conditions that increase the likelihood of developing chronic diseases or exacerbate existing health conditions. Environmental risk factors. Environmental risk factors such as air pollution, water contamination, occupational hazards, climate change, and socioeconomic disparities contribute to the burden of chronic diseases. Environmental risk factors. Environmental risk factors such as air pollution, water contamination, occupational hazards, climate change, and socioeconomic disparities contribute to the burden of chronic diseases by influencing health behaviors, exacerbating physiological stress, and increasing exposure to toxins and carcinogens. Cancer prevention and treatment. Cancer overview. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells, leading to the formation of tumors and disruption of normal bodily functions. Cancer can affect any part of the body and may be caused by genetic mutations, environmental factors, lifestyle behaviors, and infectious agents. Cancer risk factors. Genetic factors. Genetic mutations and inherited susceptibility genes, for example, BRCA1, BRCA2, play a role in some cancers, increasing the risk of developing malignancies such as breast cancer, ovarian cancer, colorectal cancer, and melanoma. Environmental exposures. Environmental risk factors such as tobacco smoke, ultraviolet, UV, radiation, ionizing radiation, chemical carcinogens, for example, asbestos, benzene, and infectious agents, for example, human papillomavirus, hepatitis B virus, contribute to the development of cancer. Lifestyle behaviors. Modifiable lifestyle factors such as unhealthy diet, physical inactivity, tobacco use, excessive alcohol consumption, and obesity are associated with an increased risk of various cancers and contribute to cancer prevention efforts. Age and gender. Advancing age is a significant risk factor for cancer, as the accumulation of genetic mutations and exposure to environmental carcinogens increases over time. Some cancers also exhibit gender disparities in incidence, with certain types more common in males, for example, prostate cancer, or females, for example, breast cancer. Family history. A family history of cancer, especially in first-degree relatives, parents, siblings, children, may indicate a hereditary predisposition to certain cancers and warrant genetic counseling, screening, or preventive interventions. Cancer prevention strategies. Primary prevention. Primary prevention strategies aim to reduce the incidence of cancer by addressing modifiable risk factors, promoting healthy behaviors, and implementing population-based interventions such as tobacco control policies, sun protection and skin cancer awareness campaigns, vaccination against cancer-related infectious agents, for example, HPV vaccine, healthy diet and nutrition programs, physical activity promotion. Secondary prevention. Secondary prevention focuses on early detection and screening to identify cancer at an early stage when treatment is most effective. Screening tests such as mammography, colonoscopy, pap smear, and prostate-specific antigen (PSA) test can detect precancerous lesions or early-stage cancers before symptoms develop. Tertiary prevention. Tertiary prevention aims to improve outcomes and quality of life for individuals diagnosed with cancer through timely diagnosis, appropriate treatment, supportive care, and survivorship programs. It includes access to oncology services, multidisciplinary care teams, palliative care, rehabilitation, and psychosocial support. Cancer treatment modalities. Surgery. Surgical resection is a common treatment modality for localized cancers, aiming to remove tumors and surrounding tissues to achieve complete excision and prevent disease recurrence. Minimally invasive techniques such as laparoscopy and robotic surgery offer advantages such as shorter recovery times and reduced morbidity. Chemotherapy. Chemotherapy involves the use of cytotoxic drugs to kill rapidly dividing cancer cells and shrink tumors. Chemotherapeutic regimens may be administered orally or intravenously and may be used alone or in combination with surgery, radiation therapy, or targeted therapy. Radiation therapy. Radiation therapy delivers high-energy radiation beams to cancerous tissues to destroy cancer cells and inhibit their growth. It may be used as a primary treatment modality or in conjunction with surgery or chemotherapy, depending on the type and stage of cancer. Targeted therapy. Targeted therapy targets specific molecular pathways or cellular components involved in cancer growth and progression, such as tyrosine kinases, growth factor receptors, and angiogenesis inhibitors. Targeted drugs are designed to block cancer-specific signaling pathways while sparing normal cells, reducing toxicity and improving efficacy. Immunotherapy. Immunotherapy harnesses the body's immune system to recognize and eliminate cancer cells by stimulating immune responses or overcoming immune suppression mechanisms. Immunotherapeutic approaches include immune checkpoint inhibitors, adoptive cell therapy, cancer vaccines, and monoclonal antibodies. Cancer survivorship and supportive care. Cancer survivorship. Cancer survivorship focuses on the physical, emotional, social, and practical needs of individuals living with and beyond cancer diagnosis and treatment. Survivorship care plans, survivorship clinics, and survivorship programs address long-term effects, late complications, surveillance, and quality of life issues. Supportive care. Supportive care services provide holistic support to cancer patients and their families throughout the cancer continuum, including symptom management, pain control, nutrition counseling, psychosocial support, palliative care, and end-of-life care. Multidisciplinary care teams collaborate to address the diverse needs of cancer patients and optimize their well-being. Cardiovascular diseases and interventional cardiology. Cardiovascular diseases, CVD, overview. Cardiovascular diseases encompass a group of disorders affecting the heart and blood vessels, including coronary artery disease, CAD, hypertension, heart failure, stroke, peripheral arterial disease, and rheumatic heart disease. CVD is a leading cause of morbidity and mortality worldwide, contributing to cardiovascular events such as myocardial infarction, heart attack, stroke, and sudden cardiac death. Risk factors for cardiovascular diseases. Modifiable risk factors. Modifiable risk factors for CVD include unhealthy diet, physical inactivity, tobacco use, excessive alcohol consumption, obesity, hypertension, dyslipidemia, diabetes mellitus, and psychosocial factors, for example, stress, depression. Lifestyle modifications such as smoking cessation, regular exercise, healthy eating, weight management, and stress reduction can reduce CVD risk and improve cardiovascular health. Non-modifiable risk factors. Non-modifiable risk factors for CVD include age, gender, family history of CVD, genetic predisposition, and ethnicity. Advancing age, male sex, positive family history, and certain genetic variants increase the susceptibility to CVD, while ethnicity influences the prevalence of CVD risk factors and disease burden. Pathophysiology of cardiovascular diseases. Atherosclerosis. Atherosclerosis is a chronic inflammatory condition characterized by the accumulation of plaque, atheroma, within arterial walls, leading to narrowing, stenosis, and hardening, calcification, of blood vessels. Atherosclerotic plaques may rupture, causing thrombosis, ischemia, and cardiovascular events such as myocardial infarction and stroke. Hypertension, or high blood pressure, is a common risk factor for CVD characterized by elevated systemic arterial pressure. Chronic hypertension contributes to endothelial dysfunction, arterial stiffness, remodeling of blood vessels, and target organ damage, increasing the risk of coronary artery disease, heart failure, stroke, and renal disease. Heart failure. Heart failure occurs when the heart is unable to pump blood effectively to meet the body's metabolic demands, leading to symptoms such as fatigue, DYS, knee edema, and exercise intolerance. Heart failure may result from various etiologies, including myocardial infarction, hypertension, cardiomyopathy, valvular heart disease, and chronic kidney disease. It is classified based on left ventricular ejection fraction, LVEF, as heart failure with reduced ejection fraction, FREF, heart failure with preserved ejection fraction, FPEF, or heart failure with mid-range ejection fraction, FMREF. Diagnostic evaluation of cardiovascular diseases. History and physical examination. The evaluation of cardiovascular diseases begins with a comprehensive medical history, including risk factors, symptoms, family history, and lifestyle behaviors. Physical examination assesses vital signs, cardiovascular signs, for example, heart sounds, murmurs, jugular venous distension, and signs of peripheral vascular disease. Laboratory tests. Laboratory tests such as lipid profile, fasting blood glucose, hemoglobin A1c, electrolytes, renal function tests, and cardiac biomarkers, for example, troponin, B-type natriuretic peptide, provide diagnostic and prognostic information in patients with cardiovascular risk factors or acute cardiac symptoms. Imaging studies. Imaging studies such as electrocardiography, ECG, echocardiography, stress testing, cardiac computed tomography, CT, cardiac magnetic resonance imaging, MI, and coronary angiography help diagnose structural heart abnormalities, assess cardiac function, detect ischemia, and evaluate coronary artery disease. Invasive procedures. Invasive procedures such as cardiac catheterization, coronary angiography, percutaneous coronary intervention, PCI, and coronary artery bypass grafting, CABG, are performed to visualize coronary arteries, assess hemodynamic parameters, and provide therapeutic interventions for obstructive coronary lesions. Interventional cardiology. Percutaneous coronary intervention, PCI, also known as angioplasty, is a minimally invasive procedure used to treat coronary artery disease by restoring blood flow to the heart muscle. It involves the insertion of a catheter with a balloon at its tip into the blocked artery, followed by balloon inflation to compress the plaque and placement of a stent to maintain vessel patency. Coronary stenting. Coronary stents are small mesh-like tubes inserted into narrowed or blocked coronary arteries during PCI to keep them open and improve blood flow to the heart. Stents may be bare metal stents, BMS, or drug-eluting stents, DES, coated with medications that prevent restenosis. Intravascular imaging. Intravascular imaging techniques such as intravascular ultrasound, IVUS, and optical coherence tomography, OCTOBA, provide high-resolution images of coronary arteries and stent placement, guiding PCI procedures, assessing lesion morphology, and optimizing stent deployment. Structural heart interventions. Structural heart interventions involve catheter-based procedures to repair or replace diseased heart valves, close congenital defects, or treat other structural heart abnormalities without open heart surgery. Examples include transcatheter aortic valve replacement, TAVE, transcatheter mitral valve repair, TMVR, and closure of atrial septal defects, ASD, or patent foramen valve, PFO. Electrophysiology procedures. Electrophysiology procedures such as cardiac ablation, pacemaker implantation, implantable cardioverter defibrillator, ICD, insertion, and cardiac resynchronization therapy, CRT, are performed to diagnose and treat arrhythmias, conduction disorders, and heart failure using catheter-based techniques and device implantation. Respiratory diseases and pulmonology. Respiratory diseases overview. Respiratory diseases affect the lungs and airways, impairing breathing, gas exchange, and pulmonary function. Common respiratory conditions include chronic obstructive pulmonary disease, COPD, asthma, pneumonia, tuberculosis, lung cancer, pulmonary hypertension, and sleep-disordered breathing disorders such as obstructive sleep apnea, OSA. Risk factors for respiratory diseases. Smoking. Tobacco smoking is the leading cause of preventable respiratory diseases, including COPD, lung cancer, asthma exacerbations, and respiratory infections. Cigarette smoke contains harmful chemicals and carcinogens that damage lung tissue, impair ciliary clearance, and promote inflammation and oxidative stress. Environmental exposures. Environmental risk factors such as air pollution, occupational hazards, for example, asbestos, silica, coal dust, indoor allergens, for example, mold, pet dander, and outdoor allergens, for example, pollen, pollution, contribute to the development and exacerbation of respiratory diseases. Infectious agents. Infectious agents such as bacteria, viruses, fungi, and parasites cause respiratory infections such as pneumonia, bronchitis, tuberculosis, influenza, and COVID-19. Respiratory viruses such as influenza virus, respiratory syncytial virus, RSV, and coronaviruses can cause seasonal epidemics and pandemics, posing significant public health threats. Genetic factors. Genetic predisposition and hereditary factors influence the risk of developing respiratory diseases such as asthma, cystic fibrosis, alpha-1 antitrypsin deficiency, and interstitial lung diseases. Genetic variants affect lung development, immune responses, and susceptibility to environmental exposures, contributing to disease pathogenesis. Diagnostic evaluation of respiratory diseases. Clinical assessment. The evaluation of respiratory diseases begins with a thorough clinical assessment, including a detailed medical history, physical examination, and review of symptoms such as cough, dyspnea, wheezing, chest pain, and sputum production. Occupational history, smoking status, exposure to allergens, and travel history are also evaluated. Pulmonary function tests. PFTs. Pulmonary function tests assess lung function, volumes, capacities, and gas exchange parameters to diagnose and monitor respiratory conditions such as COPD, asthma, restrictive lung diseases, and pulmonary vascular disorders. Common PFTs include spirometry, lung volumes, diffusing capacity, and bronchial provocation tests. Imaging studies. Imaging studies such as chest X-ray, computed tomography, CT, scan, magnetic resonance imaging, MI, and positron emission tomography, PET, Scan provide detailed anatomical and functional information about the lungs, airways, and thoracic structures. Imaging findings help diagnose respiratory diseases, assess disease severity, and guide treatment decisions. Laboratory tests such as blood tests, sputum analysis, arterial blood gas, ABG, analysis, and microbiological cultures aid in the diagnosis and management of respiratory infections, inflammatory conditions, and systemic diseases affecting the respiratory system. Treatment modalities for respiratory diseases. Bronchodilators such as beta agonists, for example, albuterol, anticholinergics, for example, ipratropium, and methylxanthines, for example, theophylline, are commonly used to relieve bronchospasm, improve airflow, and alleviate symptoms in patients with obstructive airway diseases such as COPD and asthma. Inhaled corticosteroids, ICS, such as fluticasone, budesonide, and beclomethasone are anti-inflammatory medications used as maintenance therapy to reduce airway inflammation, prevent exacerbations, and improve lung function in patients with asthma and COPD. They are often prescribed in combination with long-acting bronchodilators for optimal disease control. Antibiotics and antivirals. Antibiotics such as macrolides, fluoroquinolones, and beta-lactams are prescribed to treat bacterial respiratory infections such as pneumonia, bronchitis, and exacerbations of COPD. Antiviral medications such as oseltamivir and zanamivir are used to manage influenza virus infections and reduce complications. Oxygen therapy. Oxygen therapy delivers supplemental oxygen to patients with hypoxemia or respiratory failure to improve oxygenation, relieve dyspnea, and prevent tissue hypoxia. Oxygen may be administered via nasal cannula, mask, or mechanical ventilation, with oxygen flow rates titrated to achieve target oxygen saturations. Non-invasive ventilation. NIV non-invasive ventilation techniques such as continuous positive airway pressure, CPAP, and bilevel positive airway pressure, BiPAP, provide ventilatory support to patients with respiratory failure, hypercapnia, or sleep-disordered breathing disorders such as obstructive sleep apnea, OSA. NIV improves gas exchange, reduces work of breathing, and prevents intubation in selected patients. Pulmonary rehabilitation. Pulmonary rehabilitation programs offer multidisciplinary interventions, including exercise training, education, nutritional counseling, and psychosocial support, to improve exercise capacity, respiratory symptoms, quality of life, and self-management skills in patients with chronic respiratory diseases such as COPD and interstitial lung disease. Lung transplantation. Lung transplantation is a surgical procedure performed in select patients with end-stage lung disease refractory to medical therapy, such as idiopathic pulmonary fibrosis, IPF, cystic fibrosis, emphysema, and pulmonary hypertension. Lung transplantation improves survival, quality of life, and functional status in eligible candidates with advanced lung disease. End-of-life care. End-of-life care focuses on providing comfort, dignity, and support to patients with advanced respiratory diseases and their families during the terminal phase of illness. Palliative care, symptom management, advanced care planning, and hospice services address physical, emotional, spiritual, and social needs at the end of life. Gastrointestinal disorders and gastroenterology. Gastrointestinal disorders overview. Gastrointestinal disorders affect the digestive system, including the esophagus, stomach, intestines, liver, gallbladder, and pancreas. Common gastrointestinal conditions include gastroesophageal reflux disease, GERD, peptic ulcer disease, inflammatory bowel disease, IBD, irritable bowel syndrome, IBS, liver cirrhosis, hepatitis, pancreatitis, and gastrointestinal cancers. Risk factors for gastrointestinal disorders. Dietary factors. Dietary factors such as high fat, high sugar, low fiber diets, spicy foods, caffeine, alcohol, and food additives may contribute to the development or exacerbation of gastrointestinal disorders such as GERD, peptic ulcer disease, gastritis, and IBS. Lifestyle behaviors. Lifestyle behaviors such as smoking, excessive alcohol consumption, lack of physical activity, and stress can affect gastrointestinal health, increase the risk of gastrointestinal cancers, and exacerbate symptoms of functional gastrointestinal disorders such as IBS and functional dyspepsia. Medications. Medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, aspirin, corticosteroids, antibiotics, proton pump inhibitors, PPIs, and oral contraceptives may cause gastrointestinal side effects, including dyspepsia, gastritis, peptic ulcers, and medication-induced liver injury. Infectious agents. Infectious agents such as bacteria, for example, Helicobacter pylori, Salmonella, Campylobacter, viruses, for example, hepatitis viruses, norovirus, and parasites, for example, Giardia, Cryptosporidium, can cause gastrointestinal infections, gastroenteritis, and foodborne illnesses. Genetic factors. Genetic predisposition, familial clustering, and hereditary syndromes influence the risk of developing gastrointestinal disorders such as colorectal cancer, familial adenomatous polyposis, FAP, Lynch syndrome, hereditary hemochromatosis, and alpha-1 antitrypsin deficiency. Diagnostic evaluation of gastrointestinal disorders. Clinical assessment. The evaluation of gastrointestinal disorders begins with a comprehensive clinical assessment, including a detailed medical history, physical examination, and review of symptoms such as abdominal pain, bloating, diarrhea, constipation, nausea, vomiting, hematemesis, melena, and jaundice. Dietary habits, medication use, alcohol consumption, and travel history are also evaluated. Endoscopic procedures. Endoscopic procedures such as esophagogastrogradinoscopy, EGD, colonoscopy, sigmoidoscopy, endoscopic ultrasound, EUs, and capsule endoscopy are performed to visualize the gastrointestinal tract, obtain tissue samples, biopsy, and diagnose conditions such as GERD, peptic ulcer disease, gastrointestinal bleeding, inflammatory bowel disease, IBD, and gastrointestinal cancers. Imaging studies. Imaging studies such as abdominal ultrasound, computed tomography, CT, scan, magnetic resonance imaging, MI, and positron emission tomography, PET, scan provide detailed anatomical information about the gastrointestinal organs, liver, pancreas, and biliary system. Imaging findings help diagnose structural abnormalities, evaluate disease extent, and guide treatment decisions. Laboratory tests. Laboratory tests such as complete blood count, CBC, comprehensive metabolic panel, CMP, liver function tests, LFTs, fecal occult blood test, FOBT, stool culture, serological markers, for example, celiac disease antibodies, viral hepatitis markers, and tumor markers, for example, carcinoembryonic antigen, CEA, alpha-fetoprotein, AFP, aid in the diagnosis, monitoring, and management of gastrointestinal disorders. Treatment modalities for gastrointestinal disorders. Pharmacotherapy. Pharmacotherapy plays a central role in the management of gastrointestinal disorders, with medications prescribed to relieve symptoms, control inflammation, eradicate infections, and prevent complications. Common classes of gastrointestinal medications include antacids and acid suppressants. Antacids, for example, calcium carbonate, magnesium hydroxide, and acid suppressants, for example, proton pump inhibitors, PPIs, H2 receptor antagonists, are used to reduce gastric acid secretion, alleviate symptoms of GERD, peptic ulcer disease, and gastritis, and promote mucosal healing. Antibiotics. Antibiotics such as amoxicillin, clarithromycin, metronidazole, and tetracycline are prescribed to eradicate bacterial infections such as Helicobacter pylori gastritis, bacterial overgrowth syndrome, and infectious diarrhea caused by bacterial pathogens. Anti-inflammatory agents. Anti-inflammatory agents such as corticosteroids, 5-aminosalicylates, and immunomodulators are used to induce and maintain remission in patients with inflammatory bowel disease, IBD, including Crohn's disease and ulcerative colitis. These medications reduce intestinal inflammation, alleviate symptoms such as abdominal pain, diarrhea, and rectal bleeding, and prevent disease flares. Immunosuppressants. Immunosuppressive medications such as azathioprine, 6-mercaptopurine, methotrexate, and cyclosporine are prescribed to modulate the immune response, suppress autoimmune reactions, and maintain remission in patients with autoimmune gastrointestinal disorders such as IBD and autoimmune hepatitis. Biologic therapies. Biologic therapies such as tumor necrosis factor, TNF, inhibitors, for example, infliximab, adalimumab, golimumab, interleukin inhibitors, for example, ustekinumab, vedolizumab, and integrin antagonists, for example, vedolizumab, target specific molecules and pathways involved in the pathogenesis of gastrointestinal diseases. Biologics are used to induce and sustain remission, reduce inflammation, and improve symptoms in patients with refractory or severe disease. Antiemetics. Antiemetic medications such as ondansetron, promethazine, and metoclopramide are prescribed to relieve nausea and vomiting associated with gastrointestinal disorders, chemotherapy-induced nausea and vomiting, CINV, and postoperative nausea and vomiting, PONV. Laxatives and antidiarrheals. Laxatives, for example, fiber supplements, osmotic laxatives, stimulant laxatives, and antidiarrheal agents, for example, loperamide, bismuth subsalicylate, dipenoxylate/atropine, are used to manage constipation and diarrhea, respectively, in patients with functional bowel disorders such as irritable bowel syndrome, IBS, and chronic idiopathic constipation, CIC. Probiotics and probiotics. Probiotics are live microorganisms that confer health benefits when consumed in adequate amounts, promoting gastrointestinal health, immune function, and microbial balance in the gut microbiota. Probiotics are non-digestible fibers that stimulate the growth and activity of beneficial bacteria in the colon, enhancing digestive health and nutrient absorption. Nutritional therapy. Nutritional therapy plays a supportive role in the management of gastrointestinal disorders, with dietary modifications, nutritional supplements, and enteral or parenteral nutrition used to optimize nutritional status, alleviate symptoms, and promote healing in patients with malabsorption syndromes, inflammatory bowel disease, IBD, short bowel syndrome, and gastrointestinal cancers. Neurological disorders and neurology. Neurological disorders overview. Neurological disorders affect the nervous system, including the brain, spinal cord, nerves, and muscles, impairing sensory, motor, cognitive, and autonomic functions. Common neurological conditions include stroke, epilepsy, migraine, Parkinson's disease, Alzheimer's disease, multiple sclerosis, neuropathy, and neuromuscular disorders. Risk factors for neurological disorders. Age. Advancing age is a significant risk factor for many neurological disorders, including stroke, dementia, Parkinson's disease, and peripheral neuropathy. Age-related changes in the brain, vasculature, and neuronal function increase the susceptibility to neurodegenerative diseases and cerebrovascular events. Genetics. Genetic factors play a role in the pathogenesis of various neurological disorders, influencing disease susceptibility, progression, and familial clustering. Genetic mutations, polymorphisms, and hereditary syndromes contribute to conditions such as Alzheimer's disease, Huntington's disease, amyotrophic lateral sclerosis, ALS, and Charcot-Marie tooth disease. Lifestyle factors. Lifestyle factors such as smoking, excessive alcohol consumption, physical inactivity, obesity, and poor diet quality are associated with an increased risk of stroke, dementia, cognitive decline, and neurodegenerative diseases. Healthy lifestyle behaviors, including regular exercise, balanced nutrition, and cognitive stimulation, can reduce the risk of neurological disorders and promote brain health. Environmental exposures. Environmental factors such as toxins, pollutants, heavy metals, pesticides, and infectious agents may contribute to the development or exacerbation of neurological diseases. Occupational exposures. Air pollution, water contamination, and living in urban areas with high traffic density are associated with increased neurological risks. Medical conditions. Medical conditions such as hypertension, diabetes mellitus, hyperlipidemia, cardiovascular diseases, autoimmune disorders, and traumatic injuries increase the risk of neurological complications, including stroke, cognitive impairment, and peripheral neuropathy. Chronic diseases and comorbidities affect vascular health, inflammatory responses, and neural integrity, predisposing individuals to neurological disorders. Diagnostic evaluation of neurological disorders. Neurological examination. The evaluation of neurological disorders begins with a comprehensive neurological examination, including assessment of mental status, cranial nerves, motor function, sensory perception, coordination, reflexes, and gait. Neurological signs and symptoms such as weakness, numbness, tingling, seizures, headaches, dizziness, and altered consciousness provide clues to localize lesions and diagnose specific neurological conditions. Neuroimaging studies. Neuroimaging studies such as computed tomography, CT, scan, magnetic resonance imaging, MRI, positron emission tomography, PET, scan, and single photon emission computed tomography, SPECT, scan provide detailed anatomical and functional information about the brain, spinal cord, and peripheral nerves. Imaging findings help identify structural abnormalities, vascular lesions, tumors, and neurodegenerative changes associated with neurological diseases. Electrophysiological tests. Electrophysiological tests such as electroencephalography, EEG, electromyography, EMG, nerve conduction studies, NCS, and evoked potentials assess the electrical activity of the brain, muscles, and nerves to diagnose neuropsychiatric disorders. Peripheral neuropathies, neuromuscular junction disorders, and demyelinating diseases. These tests measure electrical signals, muscle responses, and nerve conduction velocities to evaluate neuromuscular function, identify abnormalities in nerve transmission, and localize lesions along the nervous system. Cerebrospinal fluid analysis. Cerebrospinal fluid, CSF, analysis involves the collection and examination of CSF obtained by lumbar puncture to assess for abnormalities such as elevated protein levels, pleocytosis, increased white blood cells, glucose dysregulation, and the presence of infectious agents, for example, bacteria, viruses, fungi. CSF analysis aids in the diagnosis of inflammatory, infectious, neoplastic, and neurodegenerative conditions affecting the central nervous system. Neuropsychological testing. Neuropsychological testing assesses cognitive function, memory, attention, executive function, language, and visuospatial skills to evaluate brain function and detect cognitive impairments associated with neurological disorders such as Alzheimer's disease, vascular dementia, traumatic brain injury, and neurodevelopmental disorders. Neuropsychological tests help characterize cognitive deficits, monitor disease progression, and guide treatment planning. Treatment modalities for neurological disorders. Medications. Medications are commonly used to manage neurological disorders, alleviate symptoms, prevent disease progression, and improve quality of life. Pharmacological treatments target specific mechanisms involved in neurological diseases, including neurotransmitter modulation, neuroprotection, anti-inflammatory effects, and symptomatic relief. Examples of neurological medications include antiepileptic drugs, AEDs. Antiepileptic drugs such as carbamazepine, phenytoin, valproic acid, lamorigine, and levetiracetam are prescribed to control seizures, prevent epileptic attacks, and stabilize neuronal excitability in patients with epilepsy, seizure disorders, and neuropathic pain. Antiparkinsonian agents. Antiparkinsonian agents such as levodopa carbidopa, dopamine agonists, monoamine oxidase inhibitors, MAOIs, and catecholomethyltransferase, CANT, inhibitors are used to manage motor symptoms, tremors, rigidity, bradykinesia, and postural instability in patients with Parkinson's disease and Parkinsonian syndromes. Cholinesterase inhibitors. Cholinesterase inhibitors such as donepezil, rivastigmine, and galantamine enhance cholinergic neurotransmission, improve cognitive function, and alleviate symptoms of Alzheimer's disease and other neurodegenerative dementias by inhibiting the breakdown of acetylcholine in the brain. Immunomodulatory agents. Immunomodulatory agents such as corticosteroids, disease-modifying antirheumatic drugs, DMARDs, biologic therapies, and monoclonal antibodies are used to modulate immune responses, reduce inflammation, and modify disease progression in patients with autoimmune neurological disorders such as multiple sclerosis, myasthenia gravis, and Guillain-Barré syndrome. Analgesics. Analgesic medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, opioids, tricyclic antidepressants, and anticonvulsants are prescribed to relieve pain, neuropathic pain, and headache disorders associated with neurological conditions such as neuropathy, migraine, trigeminal neuralgia, and post-herpetic neuralgia. Muscle relaxants. Muscle relaxants such as baclofen, tizonidine, diazepam, and cyclobenzaprine are used to reduce muscle spasticity, rigidity, and involuntary movements in patients with spasticity disorders, dystonia, and neuromuscular conditions such as multiple sclerosis and spinal cord injury. Psychotropic medications. Psychotropic medications such as antidepressants, anxiolytics, antipsychotics, and mood stabilizers are prescribed to manage psychiatric symptoms, behavioral disturbances, and mood disorders associated with neurological diseases such as depression, anxiety, psychosis, and bipolar disorder. Non-pharmacological interventions. Non-pharmacological interventions are essential components of comprehensive neurological care, addressing physical, cognitive, emotional, and social needs and improving functional outcomes and quality of life. Non-pharmacological treatments complement medication management, promote rehabilitation, and facilitate patient-centered care. Examples of non-pharmacological interventions for neurological disorders include physical therapy. Physical therapy involves exercise programs, gait training, mobility aids, and assistive devices to improve strength, flexibility, balance, coordination, and mobility in patients with neurological impairments, stroke, spinal cord injury, and movement disorders such as Parkinson's disease. Occupational therapy. Occupational therapy focuses on activities of daily living, ADLs, adaptive strategies, environmental modifications, and assistive technology to enhance functional independence, self-care skills, fine motor coordination, and cognitive function in patients with neurological disabilities, traumatic brain injury, and neurodevelopmental disorders. Speech therapy. Speech therapy addresses communication deficits, speech disorders, swallowing difficulties, dysphagia, and cognitive linguistic impairments in patients with neurological conditions such as stroke, traumatic brain injury, Parkinson's disease, and dementia. Speech-language pathologists provide individualized therapy programs, oral exercises, and swallowing techniques to improve speech clarity, language comprehension, and swallowing safety. Cognitive rehabilitation. Cognitive rehabilitation programs utilize cognitive training exercises, memory aids, compensatory strategies, and psychoeducation to address cognitive impairments, attention deficits, executive dysfunction, and memory problems in patients with acquired brain injury, stroke, mild cognitive impairment, and neurodegenerative diseases such as Alzheimer's disease. Behavioral therapy. Behavioral therapy techniques such as cognitive behavioral therapy, CBT, relaxation training, biofeedback, and mindfulness-based interventions are used to manage psychological symptoms, emotional distress, and behavioral disturbances in patients with neurological disorders, chronic pain, anxiety disorders, and mood disorders. Behavioral interventions promote coping skills, stress management, and adaptive coping strategies, enhancing psychological well-being and quality of life. Access to extensive research articles, textbooks, and multimedia resources, 1TB. Research articles. Access to extensive research articles provides valuable scientific literature, peer-reviewed journals, and academic publications on various topics in mental health, psychology, disease prevention, and medical management. Research articles contribute to evidence-based practice, clinical decision-making, and scholarly inquiry, advancing knowledge and innovation in healthcare. Textbooks. Textbooks are essential educational resources that offer comprehensive coverage of fundamental concepts, theories, principles, and practices in mental health, psychology, epidemiology, immunology, oncology, cardiology, pulmonology, gastroenterology, neurology, and other medical specialties. Textbooks provide structured learning materials, case studies, illustrations, and review questions, facilitating student learning, exam preparation, and lifelong learning for healthcare professionals. Multimedia resources. Multimedia resources encompass a wide range of educational materials, including audio-visual presentations, interactive tutorials, virtual simulations, online courses, and educational videos on mental health, disease prevention, diagnostic techniques, therapeutic modalities, and medical interventions. Multimedia resources enhance learning experiences, engage learners, and accommodate diverse learning styles, promoting active learning, self-directed. Module 14, Sexual and Reproductive Health. Introduction to Sexual and Reproductive Health. Definition: Sexual and reproductive health, SRH, refers to a state of physical, emotional, mental, and social well-being related to sexuality and reproduction throughout the life course. It encompasses a range of issues, including reproductive rights, access to healthcare services, contraception, prevention and management of sexually transmitted infections, STIs, family planning, pregnancy, childbirth, sexual education, and healthy relationships. Key terms: reproductive health, the state of physical, mental, and social well-being in all matters relating to the reproductive system and its functions. Sexual health, the integration of the somatic, emotional, intellectual, and social aspects of sexual being in ways that are positively enriching and that enhance personality, communication, and love. Family planning, the conscious decision-making process by which individuals and couples decide the number, timing, and spacing of their children and choose appropriate methods to achieve their reproductive goals. Contraception, the deliberate use of methods, techniques, or devices to prevent pregnancy as a result of sexual intercourse. Sexually transmitted infections, STIs, infections transmitted through sexual contact, including bacterial, viral, and parasitic infections such as chlamydia, gonorrhea, syphilis, HIV/AIDS, herpes, HPV, and trichomoniasis. Pregnancy, the condition of carrying a developing embryo or fetus within the female reproductive system, typically occurring after fertilization of an egg by sperm and implantation in the uterus. Childbirth, the process of delivering a baby from the mother's uterus to the outside world, involving labor, delivery, and postpartum recovery. Human reproductive anatomy and physiology. Male reproductive system. Anatomy. The male reproductive system consists of external and internal structures, including the penis, scrotum, testes, epididymis, vas deferens, seminal vesicles, prostate gland, and urethra. Physiology. Sperm production, spermatogenesis, occurs in the testes, where sperm cells mature and are stored in the epididymis before ejaculation. During ejaculation, sperm travel through the vas deferens and mix with seminal fluid from the seminal vesicles and prostate gland to form semen, which is ejaculated through the urethra during sexual intercourse. Female reproductive system. Anatomy. The female reproductive system comprises external and internal organs, including the vulva, vagina, uterus, fallopian tubes, and ovaries. Physiology. Ovulation occurs monthly, releasing a mature egg, ovum, from an ovary into the fallopian tube, where fertilization by sperm can occur. If fertilization occurs, the fertilized egg travels to the uterus and implants in the uterine lining, endometrium, leading to pregnancy. If fertilization does not occur, the uterine lining sheds during menstruation. Contraception methods and family planning. Contraception methods. Barrier methods. Barrier methods such as condoms, diaphragms, cervical caps, and contraceptive sponges physically block sperm from reaching the egg, reducing the risk of pregnancy and STI transmission. Hormonal methods. Hormonal methods such as birth control pills, patches, injections, implants, and vaginal rings contain synthetic hormones, estrogen and or progestin, to inhibit ovulation, thicken cervical mucus, and prevent sperm from fertilizing an egg. Intrauterine devices, IUDs. Intrauterine devices such as copper IUDs and hormonal IUDs are small, T-shaped devices inserted into the uterus to prevent pregnancy by altering the uterine environment, inhibiting sperm motility, and preventing fertilization and implantation. Sterilization. Sterilization procedures such as tubal ligation, for women, and vasectomy, for men, involve surgical techniques to permanently block or remove reproductive structures, fallopian tubes or vas deferens, preventing sperm from reaching the egg or semen from containing sperm. Emergency contraception, also known as the morning after pill, consists of hormonal pills or copper IUD insertion after unprotected intercourse to prevent pregnancy by delaying ovulation, inhibiting fertilization, or interfering with implantation. Family planning services. Family planning services encompass a range of healthcare interventions and counseling services to assist individuals and couples in making informed decisions about contraception, pregnancy, and reproductive health. Family planning clinics offer contraceptive counseling, pregnancy testing, STI screening, counseling on fertility awareness methods, preconception care, prenatal care, and postpartum support. Access to family planning services promotes reproductive autonomy, empowers individuals to plan and space pregnancies according to their desires and circumstances, and reduces unintended pregnancies, maternal mortality, and infant morbidity. Sexually transmitted infections, STIs, and prevention. Common STIs. Chlamydia, a bacterial STI caused by Chlamydia trachomatis, transmitted through unprotected sexual contact and associated with urethritis, cervicitis, pelvic inflammatory disease, PID, and infertility if left untreated. Gonorrhea, a bacterial STI caused by Neisseria gonorrhoeae, transmitted through unprotected sexual contact and associated with urethritis, cervicitis, PID, epididymitis, and disseminated gonococcal infection, DGI, if left untreated. Syphilis, a bacterial STI caused by Treponema pallidum, transmitted through direct contact with syphilitic sores, chancre, associated with primary, secondary, and tertiary stages of infection, and complications such as neurosyphilis, cardiovascular syphilis, and congenital syphilis if untreated during pregnancy. HIV/AIDS, human immunodeficiency virus, HIV, is a viral STI that attacks the immune system, transmitted through blood, semen, vaginal fluids, and breast milk. Acquired immunodeficiency syndrome, AIDS, is the advanced stage of HIV infection, characterized by severe immune deficiency and opportunistic infections. Herpes simplex virus, HSV. Herpes is a viral STI caused by the herpes simplex virus, HSV, type 1, HSV1, and type 2, HSV2. It is transmitted through direct contact with infected skin or mucous membranes, resulting in painful genital or oral sores, recurrent outbreaks, and asymptomatic viral shedding. Human papillomavirus, HPV. HPV is a common viral STI with various strains, some of which cause genital warts, low-risk HPV, and others linked to cervical, anal, penile, and oropharyngeal cancers, high-risk HPV. HPV is transmitted through sexual contact and can be prevented with vaccination. Hepatitis B and C. Hepatitis B and C viruses cause liver inflammation and liver disease, transmitted through blood, semen, vaginal fluids, and needle sharing. Chronic hepatitis B and C infections can lead to liver cirrhosis, liver failure, and hepatocellular carcinoma. Prevention strategies. Safe sex practices. Practicing safe sex by using condoms consistently and correctly during sexual intercourse reduces the risk of STI transmission, including HIV, gonorrhea, chlamydia, syphilis, and herpes. Condoms provide a barrier against bodily fluids and genital skin contact, preventing direct exposure to infectious agents. STI screening and testing. Routine screening and testing for STIs are recommended for sexually active individuals, particularly those with multiple partners, new partners, or high-risk behaviors. Screening tests include blood tests, urine tests, swabs, and physical examinations to detect STIs early, facilitate treatment, and prevent complications. Vaccination. Vaccination against preventable STIs such as HPV and hepatitis B reduces the risk of infection, transmission, and associated cancers. HPV vaccination is recommended for adolescents and young adults to prevent cervical cancer, genital warts, and other HPV-related cancers. Hepatitis B vaccination is recommended for infants, children, and high-risk adults to prevent chronic hepatitis B infection and liver disease. Partner notification and treatment. Partner notification and treatment involve informing sexual partners about potential exposure to STIs and encouraging them to seek testing, counseling, and treatment. Partner services help break the chain of transmission, prevent reinfection, and promote sexual health within communities. Pre-exposure prophylaxis. PrEP. Pre-exposure prophylaxis with antiretroviral medications such as tenofovir/imtricitabine, Truvada, is recommended for individuals at high risk of HIV infection, including HIV-negative individuals with HIV-positive partners, injection drug users, and commercial sex workers. PrEP reduces the risk of HIV acquisition when taken consistently and combined with other preventive measures. Post-exposure prophylaxis. PEP. Post-exposure prophylaxis with antiretroviral medications is recommended for individuals exposed to HIV through unprotected sexual intercourse, needle sharing, occupational exposure, or sexual assault. PEP should be initiated as soon as possible, within 72 hours, after exposure to prevent HIV infection and should be followed by comprehensive testing, counseling, and follow-up care. Education and counseling. Comprehensive sexual health education and counseling promote awareness, risk reduction, and informed decision-making regarding STIs, contraception, safer sex practices, partner communication, and regular healthcare seeking behavior. Counseling services provide support, guidance, and resources to individuals and communities affected by STIs, empowering them to take control of their sexual health and well-being. Pregnancy and childbirth. Prenatal care. Prenatal care involves medical supervision, screening, and support services provided to pregnant individuals to monitor maternal and fetal health, optimize pregnancy outcomes, and promote maternal-infant well-being. Prenatal visits include health assessments, physical examinations, laboratory tests, ultrasound scans, nutritional counseling, childbirth education, and psychosocial support. Antenatal testing. Antenatal testing refers to diagnostic procedures and screening tests performed during pregnancy to assess fetal development, detect congenital abnormalities, and identify maternal-fetal health risks. Common antenatal tests include ultrasound imaging, maternal serum screening, amniocentesis, chorionic villus sampling, CVS, non-stress test, NST, biophysical profile, BPP, and fetal movement counting. Labor and delivery. Labor and delivery involve the physiological process of childbirth, including the onset of contractions, cervical dilation, effacement, descent of the fetus through the birth canal, and expulsion of the placenta. Stages of labor include the latent phase, early labor, active phase, active labor, transition phase, and second stage, pushing and delivery. Delivery may occur vaginally or by cesarean section, C-section, depending on maternal and fetal indications. Postpartum care. Postpartum care encompasses medical, emotional, and social support provided to individuals during the immediate postpartum period, first 6 weeks after childbirth, to promote recovery, breastfeeding initiation, newborn care, and maternal-infant bonding. Postpartum visits include physical assessments, breastfeeding support, contraception counseling, mood screening, and family planning discussions. Men's health and reproductive issues. Men's reproductive health. Men's reproductive health encompasses a range of issues related to the male reproductive system, including fertility, sexual function, genital health, and reproductive disorders. Common men's health concerns include erectile dysfunction, male infertility, testicular cancer, prostate disorders, and sexually transmitted infections, STIs. Fertility and infertility. Fertility refers to the ability to conceive and produce offspring, influenced by factors such as age, hormonal balance, reproductive anatomy, genetic factors, lifestyle behaviors, and environmental exposures. Infertility is defined as the inability to achieve pregnancy after 1 year of regular, unprotected intercourse and affects both men and women. Male infertility may result from sperm production disorders, sperm transport abnormalities, or hormonal imbalances, requiring evaluation and treatment by a fertility specialist. Women's health and gynecological conditions. Women's reproductive health. Women's reproductive health encompasses a range of issues related to the female reproductive system, including menstruation, fertility, pregnancy, childbirth, menopause, and gynecological disorders. Common women's health concerns include menstrual irregularities, polycystic ovary syndrome, PCOS, endometriosis, uterine fibroids, ovarian cysts, and pelvic inflammatory disease, PID. Gynecological screening. Gynecological screening involves preventive health examinations, diagnostic tests, and cancer screenings performed to detect gynecological conditions and reproductive cancers early, when they are most treatable. Common gynecological screenings include pelvic exams, Pap tests, Pap smears, HPV tests, breast exams, mammograms, and bone density scans, DEXA, for osteoporosis screening. LGBTQ and health and inclusive care. 1. LGBTQ and health overview. LGBTQ and health refers to the physical, mental, and social well-being of individuals who identify as lesbian, gay, bisexual, transgender, queer, questioning, intersex, or other non-binary gender identities and sexual orientations. LGBTQ and individuals may face unique health disparities, discrimination, and barriers to healthcare access due to stigma, prejudice, and lack of cultural competence among healthcare providers. Key terms. Lesbian, a woman who is emotionally, romantically, or sexually attracted to other women. Gay, a man who is emotionally, romantically, or sexually attracted to other men, sometimes used as an umbrella term for individuals attracted to the same sex. Bisexual, an individual who is emotionally, romantically, or sexually attracted to people of more than one gender. Transgender, a person whose gender identity differs from the sex assigned to them at birth, often requiring gender-affirming medical interventions and social transitions. Queer, an umbrella term encompassing diverse sexual orientations, gender identities, and expressions that challenge traditional norms and categories. Questioning, an individual exploring or questioning their sexual orientation, gender identity, or expression. Intersex, a person born with variations in sex characteristics, including chromosomes, hormones, or reproductive anatomy, that do not fit typical definitions of male or female. Non-binary, a gender identity outside the binary categories of male and female, encompassing diverse gender expressions and identities. Health disparities and challenges. LGBTQ and individuals experience higher rates of mental health disorders, substance use disorders, suicide, intimate partner violence, and sexual assault compared to heterosexual and cisgender populations. Discrimination, harassment, bullying, and social rejection based on sexual orientation and gender identity contribute to minority stress, trauma, and psychological distress among LGBTQ+ individuals. Barriers to healthcare access include lack of culturally competent providers, discriminatory practices, financial constraints, fear of discrimination, and limited access to gender-affirming care, reproductive healthcare, and STI screening services. Transgender and gender non-conforming individuals face additional challenges related to gender dysphoria, access to gender-affirming hormone therapy, puberty suppression, chest/breast surgery, genital reconstruction surgery, legal recognition of gender identity, and inclusive healthcare policies. Sexual education and healthy relationships. Comprehensive sexual education. Comprehensive sexual education promotes age-appropriate, evidence-based education on human sexuality, reproductive health, contraception, STI prevention, healthy relationships, consent, gender identity, sexual orientation, and personal safety. Key components of comprehensive sexual education include accurate information, skill-building activities, values clarification, respect for diverse identities, LGBTQ and inclusive content, communication skills, refusal skills, decision-making strategies, and empowerment. Comprehensive sexual education programs are designed to reduce risky behaviors, unintended pregnancies, STIs, sexual coercion, and sexual violence while promoting sexual health, positive body image, self-esteem, and healthy relationships among adolescents and young adults. Healthy relationships. Healthy relationships are characterized by mutual respect, trust, communication, equality, consent, support, and shared values between partners. Key elements of healthy relationships include open communication, active listening, empathy, compromise, conflict resolution, boundaries, autonomy, and shared decision-making. Healthy relationship skills include assertive communication, emotional intelligence, conflict management, negotiation, empathy, and respect for individual differences. Healthy relationships promote emotional well-being, intimacy, satisfaction, and personal growth, contributing to overall happiness, resilience, and social connectedness. Fertility awareness and assisted reproductive technologies. Fertility awareness methods. Fertility awareness methods, FAMs, involve tracking menstrual cycles, monitoring fertility signs, and identifying fertile and infertile days to prevent or achieve pregnancy. Common fertility awareness methods include calendar-based methods, rhythm method, basal body temperature, BBT, charting, cervical mucus monitoring, Billings method, and ovulation predictor kits, OPKs. Fertility awareness requires knowledge of menstrual cycle patterns, ovulation timing, cervical mucus changes, and factors influencing fertility, such as stress, illness, medications, and lifestyle habits. Fertility awareness can be used for natural family planning, contraception, fertility monitoring, and optimizing timing of intercourse for couples trying to conceive. Advanced reproductive health technologies and fertility treatments. Assisted reproductive technologies, ART. Assisted reproductive technologies, ART, encompass medical procedures and laboratory techniques used to facilitate conception, overcome infertility, and achieve pregnancy. Common ART procedures include in vitro fertilization, IVF, intracytoplasmic sperm injection, ICSI, intrauterine insemination, IUI, egg donation, sperm donation, embryo cryopreservation, and pre-implantation genetic testing, PGT. ART treatments are indicated for couples with infertility due to factors such as ovulatory disorders, tubal factor infertility, male factor infertility, endometriosis, advanced maternal age, unexplained infertility, or genetic disorders. ART success rates vary depending on factors such as age, underlying infertility causes, treatment protocols, and the quality of gametes, eggs and sperm, used in the procedures. Cross-cultural perspectives on sexual health and reproductive rights. Cultural and religious beliefs. Cultural and religious beliefs influence attitudes, norms, values, and practices related to sexuality, reproduction, gender roles, and family structures across diverse communities and societies. Reproductive rights. Reproductive rights encompass the rights of individuals to make autonomous decisions regarding their reproductive health, including the right to access contraception, abortion, fertility treatments, prenatal care, childbirth services, and sexual education, free from coercion, discrimination, and violence. Gender equity and social justice. Gender equity and social justice efforts advocate for equal rights, opportunities, and access to resources for individuals of all genders, promoting reproductive autonomy, bodily integrity, sexual pleasure, and social inclusion. Massive datasets of sexual health research articles, epidemiological studies, and clinical trials, 1TB. Research articles. Access to massive datasets of sexual health research articles provides valuable scientific literature, peer-reviewed journals, epidemiological studies, clinical trials, and meta-analyses on topics such as contraception, STIs, infertility, reproductive technologies, sexual behavior, reproductive rights, and gender equity. Epidemiological studies. Epidemiological studies investigate the distribution, determinants, and outcomes of sexual health issues, including prevalence rates of STIs, contraceptive use patterns, fertility trends, pregnancy outcomes, sexual behaviors, risk factors for reproductive disorders, and disparities in healthcare access and utilization. Clinical trials. Clinical trials evaluate the safety, efficacy, and comparative effectiveness of interventions, treatments, and preventive strategies for sexual health conditions, including contraceptive methods, STI treatments, fertility treatments, ART procedures, sexual education programs, and behavioral interventions. Data analysis and interpretation. Access to extensive datasets enables researchers to conduct sophisticated data analyses, including statistical modeling, regression analyses, survival analyses, meta-analyses, and machine learning algorithms to identify trends, associations, risk factors, and predictors of sexual health outcomes. Data interpretation involves critically appraising research findings, drawing evidence-based conclusions, identifying gaps in knowledge, proposing hypotheses, and translating research into actionable recommendations for clinical practice, public health policy, and community interventions. Knowledge translation and application. Knowledge translation initiatives disseminate research findings, evidence-based guidelines, best practices, and educational resources to healthcare providers, policymakers, educators, community organizations, and the general public to promote informed decision-making, health literacy, and behavior change. Application of research evidence in clinical settings involves integrating scientific knowledge into patient care practices, counseling patients on sexual health issues, implementing evidence-based interventions, monitoring outcomes, and adapting strategies based on patient preferences, cultural considerations, and local contexts. Future directions and research priorities. Future research in sexual and reproductive health should focus on addressing emerging trends, advancing scientific understanding of sexual health issues, evaluating the effectiveness of innovative interventions, reducing health disparities, promoting gender equity, and protecting reproductive rights. Research priorities include investigating the impact of social determinants of health on sexual health outcomes, exploring the role of technology in sexual health promotion and disease prevention, developing culturally tailored interventions for underserved populations, and advocating for policies that support sexual and reproductive rights globally. In conclusion, the module on sexual and reproductive health provides comprehensive coverage of key topics, including human reproductive anatomy, contraception, STI prevention, pregnancy, LGBTQ and health, fertility awareness, assisted reproductive technologies, cultural perspectives, and research methodologies. Through a multidisciplinary approach and access to extensive datasets, students gain a deep understanding of sexual health issues, research methodologies, and evidence-based interventions to promote sexual and reproductive well-being across diverse populations and settings. Ethical considerations in sexual and reproductive health. Ethical issues in sexual and reproductive health encompass autonomy, privacy, confidentiality, informed consent, reproductive rights, justice, and equity. Researchers and healthcare providers must uphold ethical standards in conducting research, providing care, respecting patients' rights, maintaining confidentiality, and ensuring culturally competent and non-discriminatory practices. Ethical dilemmas may arise in areas such as reproductive technologies, adolescent healthcare, LGBTQ and healthcare, and abortion services, requiring careful consideration of moral, legal, and professional obligations. Global perspectives on sexual and reproductive health. Sexual and reproductive health is influenced by cultural, social, economic, and political factors, resulting in diverse practices, beliefs, and policies worldwide. Disparities in access to sexual health services, contraception, maternal healthcare, and abortion services persist across regions, highlighting the need for international collaboration, advocacy, and resource allocation to address global health inequities. Cross-cultural understanding and sensitivity are essential in promoting sexual health rights, reducing stigma, and advocating for comprehensive sexual education and reproductive healthcare services globally. Intersectionality and sexual health equity. Intersectionality recognizes the interconnectedness of social identities, such as race, ethnicity, gender, sexuality, socioeconomic status, and disability, in shaping individuals' experiences of sexual health and access to care. Marginalized populations, including racial and ethnic minorities, LGBTQ and individuals, people with disabilities, and those from low-income backgrounds, face disproportionate barriers to sexual health services and experience higher rates of adverse sexual health outcomes. Addressing health disparities requires a multidimensional approach that acknowledges the intersecting factors contributing to inequities and promotes inclusive, culturally competent, and rights-based sexual health policies and programs. Advocacy and policy development in sexual and reproductive health. Advocacy efforts aim to promote sexual health rights, expand access to comprehensive sexual education, ensure reproductive autonomy, and challenge discriminatory laws and policies. Policy development involves crafting legislation, regulations, and guidelines that protect sexual and reproductive rights, allocate resources for sexual health services, and address systemic barriers to care. Collaboration between policymakers, healthcare providers, researchers, advocates, and community organizations is essential in advancing evidence-based policies that promote sexual and reproductive health equity and address the diverse needs of populations globally. In summary, the module on sexual and reproductive health provides a comprehensive exploration of key concepts, ethical considerations, global perspectives, intersectionality, and advocacy efforts in promoting sexual health equity. Through a multidisciplinary lens and emphasis on social justice, students gain the knowledge and skills necessary to address sexual health disparities, advocate for policy change, and promote inclusive, rights-based sexual and reproductive health care for all individuals. Advanced research and innovations in sexual and reproductive health. Ongoing advancements in sexual and reproductive health research encompass innovative technologies, treatment modalities, and preventive strategies aimed at improving outcomes and expanding access to care. Areas of research include novel contraceptive methods, such as long-acting reversible contraceptives, LARCs, hormonal implants, and non-hormonal options, offering greater choice and efficacy for individuals. Innovations in fertility treatments, including in vitro fertilization, IVF, pre-implantation genetic testing, and gamete intrafallopian transfer, GIFT, provide options for individuals and couples facing infertility challenges. Emerging technologies, such as telemedicine, mobile health, mHealth, applications, and online platforms, offer new avenues for delivering sexual health information, counseling, and services remotely, addressing barriers to access and stigma. Cultural competence and sensitivity in sexual and reproductive healthcare. Cultural competence in sexual and reproductive healthcare involves understanding and respecting diverse cultural beliefs, values, norms, and practices related to sexuality, reproduction, and gender. Healthcare providers must undergo training to enhance their cultural competence, communication skills, and awareness of implicit biases to provide inclusive and patient-centered care. Tailoring healthcare services to meet the cultural and linguistic needs of diverse populations fosters trust, improves patient-provider communication, and enhances health outcomes. Culturally competent care also involves recognizing and addressing social determinants of health, such as poverty, discrimination, and structural inequalities, that impact individuals' access to sexual and reproductive health care. Psychosocial support and counseling in sexual and reproductive health. Psychosocial support plays a crucial role in addressing the emotional, mental, and relational aspects of sexual and reproductive health concerns. Counseling services provide individuals and couples with a safe space to explore their feelings, concerns, and goals related to sexuality, fertility, pregnancy, contraception, and reproductive decision-making. Effective counseling approaches, such as motivational interviewing, cognitive behavioral therapy, CBT, and trauma-informed care, help clients navigate challenges, make informed choices, and cope with emotional distress. Interdisciplinary collaboration between healthcare providers, psychologists, social workers, and counselors enhances the delivery of comprehensive, integrated care that addresses both physical and psychosocial dimensions of sexual and reproductive health. Peer education and community-based interventions in sexual and reproductive health. Peer education programs engage community members, particularly young people, in promoting sexual health awareness, knowledge, and positive behaviors among their peers. These programs empower individuals to become advocates for sexual health rights, challenge stigma, and disseminate accurate information about contraception, STI prevention, consent, and healthy relationships. Community-based interventions, such as youth-friendly clinics, outreach initiatives, and peer support groups, create accessible and supportive environments for individuals to access sexual health services and resources. Collaborative partnerships between schools, healthcare facilities, non-governmental organizations, NGOs, and community leaders facilitate the development and implementation of effective community-based interventions that address local sexual health needs and priorities. Continuing with the exploration of sexual and reproductive health, these topics delve into advanced research, cultural competence, psychosocial support, and community-based interventions, offering a comprehensive understanding of the multifaceted nature of sexual health promotion and care. Certainly, let's continue. Legal and ethical considerations in sexual and reproductive health. Legal and ethical frameworks guide the provision of sexual and reproductive healthcare, ensuring patient autonomy, confidentiality, and informed consent. Key ethical principles, such as beneficence, non-maleficence, justice, and respect for persons, inform decision-making in clinical practice and research involving sexual and reproductive health. Ethical dilemmas may arise in areas such as reproductive rights, abortion access, assisted reproductive technologies, and adolescent healthcare, requiring careful consideration of competing interests and values. Healthcare providers must navigate complex legal and regulatory landscapes, including laws governing confidentiality, mandatory reporting of certain conditions, parental consent requirements, and conscientious objection clauses. Global perspectives on sexual and reproductive health. Sexual and reproductive health is a global issue influenced by diverse cultural, social, economic, and political contexts. Disparities in access to sexual and reproductive healthcare exist between and within countries, shaped by factors such as gender inequality, poverty, armed conflict, and humanitarian crises. International organizations, including the World Health Organization, WHO, United Nations Population Fund, UNFPA, and non-governmental organizations, NGOs, play critical roles in promoting sexual and reproductive health rights, providing technical assistance, and advocating for policy change. Global health initiatives, such as the Sustainable Development Goals, SDGs, aim to improve maternal and child health, reduce HIV/AIDS prevalence, increase access to contraception, and address gender-based violence, recognizing the interconnectedness of health and development. Emerging issues and future directions in sexual and reproductive health. Rapid advances in technology, changing social norms, and evolving healthcare systems present both opportunities and challenges for sexual and reproductive health. Emerging issues include the impact of digital technologies on sexual behaviors and relationships, the rise of sexually transmitted infections, STIs, among certain populations, and the integration of reproductive health services into primary care settings. Future directions in research and practice involve addressing gaps in knowledge, harnessing technology for health promotion and service delivery, strengthening health systems, and advocating for policies that promote sexual and reproductive rights and equity. Interdisciplinary collaboration, community engagement, and innovation are essential for addressing emerging challenges and achieving the goals of sexual and reproductive health promotion and care in the 21st century. These topics further expand on the complexities and nuances of sexual and reproductive health, encompassing legal, ethical, global, and future-oriented perspectives to provide a comprehensive understanding of this vital aspect of public health and healthcare. Module 15, Sexual Education and Psychology. Introduction to Sexual Education. Sexual education encompasses a broad range of topics related to human sexuality, including anatomy, physiology, relationships, and sexual health. It aims to provide individuals with accurate, age-appropriate information and skills to make informed decisions about their sexual health and well-being. Reproductive anatomy and physiology. Reproductive anatomy refers to the structure of the male and female reproductive systems, including organs such as the penis, testes, ovaries, uterus, and vagina. Reproductive physiology involves the functions of these organs, such as hormone production, gamete, sperm and egg formation, fertilization, and pregnancy. Contraception methods and family planning. Contraception methods are strategies used to prevent unintended pregnancies and sexually transmitted infections, STIs. These methods include barrier methods, for example, condoms, hormonal methods, for example, birth control pills, intrauterine devices, IUDs, and fertility awareness-based methods. Family planning involves the conscious decision-making process regarding when to have children, how many children to have, and spacing pregnancies. STIs and sexual health risks. Sexually transmitted infections, STIs, are infections transmitted through sexual contact, including genital herpes, chlamydia, gonorrhea, syphilis, HIV/AIDS, and human papillomavirus, HPV. Understanding STIs and their risks is crucial for practicing safe sex and preventing transmission, including the importance of condom use, regular testing, and communication with sexual partners. Consent and healthy relationships. Consent refers to the voluntary agreement to engage in sexual activity, given freely and enthusiastically by all parties involved. Healthy relationships are characterized by mutual respect, trust, communication, and the absence of coercion or violence. Teaching about consent and healthy relationships promotes positive sexual experiences and reduces the risk of sexual assault and relationship abuse. Gender and sexual diversity. Gender refers to the socially constructed roles, behaviors, and expectations associated with being male, female, or non-binary. Sexual diversity encompasses a range of sexual orientations and identities beyond heterosexual, including lesbian, gay, bisexual, transgender, queer, intersex, and asexual. Understanding and respecting gender and sexual diversity fosters inclusivity and support for individuals of all identities. Communication skills in sexual relationships. Effective communication is essential for expressing desires, boundaries, and concerns in sexual relationships. Skills such as active listening, assertiveness, empathy, and negotiation help individuals navigate sexual encounters and build intimacy with their partners. Sexual attraction and desire. Sexual attraction refers to the emotional, physical, and or sexual attraction to another person. Sexual desire encompasses the urge or motivation to engage in sexual activity, influenced by biological, psychological, and social factors. Sexual development and identity. Sexual development involves the physical, emotional, and psychological changes that occur as individuals mature sexually, from childhood through adolescence to adulthood. Sexual identity refers to how individuals understand and label their own sexual orientation, gender identity, and expression. Sexual arousal and pleasure. Sexual arousal is the physiological and psychological response to sexual stimuli, leading to increased blood flow, lubrication, and other bodily changes. Sexual pleasure encompasses the sensations, emotions, and satisfaction experienced during sexual activity, contributing to overall well-being and relationship satisfaction. Intimacy and emotional connection. Intimacy involves emotional closeness, trust, and vulnerability shared between partners, enhancing the quality of sexual relationships. Emotional connection fosters deeper understanding, empathy, and support, promoting intimacy and satisfaction in sexual encounters. Sexual dysfunction and therapy. Sexual dysfunction refers to difficulties or impairments in sexual function, such as erectile dysfunction, premature ejaculation, low libido, or pain during intercourse. Therapy approaches, such as cognitive behavioral therapy, CBT, sex therapy, and medical interventions, can help individuals address underlying issues and improve sexual function and satisfaction. Sexual fantasies and behavior. Sexual fantasies are imaginative scenarios, thoughts, or images that evoke sexual arousal or pleasure. Sexual behavior encompasses the actions individuals engage in to express their sexuality, including masturbation, sexual intercourse, oral sex, and various kinks or fetishes. Cultural perspectives on sexuality. Cultural norms, beliefs, and values influence attitudes toward sexuality, shaping sexual practices, taboos, and expressions of identity. Understanding cultural diversity enhances cultural competence and sensitivity in sexual education and healthcare delivery. Social construction of gender. Gender is socially constructed through cultural norms, institutions, and interactions, influencing roles, expectations, and power dynamics between genders. Examining the social construction of gender reveals how gender norms and stereotypes impact sexual behavior, identity development, and access to resources. Sexuality and media representation. Media portrayals of sexuality, including in film, television, advertising, and pornography, shape perceptions, attitudes, and behaviors related to sex and relationships. Critical analysis of media representations fosters media literacy and awareness of the influence of media on sexual attitudes and behaviors. Sex work and sexuality in society. Sex work refers to the exchange of sexual services for money or goods, encompassing a range of activities, from prostitution to pornography and erotic dancing. Societal attitudes toward sex work vary, influenced by cultural, legal, and moral considerations, and impact the rights, safety, and well-being of sex workers. Sexuality and social movements. Social movements advocate for sexual rights, reproductive justice, and equality, challenging discrimination, stigma, and violence based on sexual orientation, gender identity, and expression. LGBTQ and rights movements, feminist movements, and sexual health advocacy groups work to advance social and political change, promoting inclusivity, diversity, and empowerment. Sexual health policies and advocacy. Sexual health policies govern access to sexual education, reproductive healthcare, contraception, and STI prevention and treatment services. Advocacy efforts aim to promote evidence-based sexual health policies, address disparities, and protect sexual and reproductive rights at local, national, and global levels. Preventive measures for sexual health. Preventive measures include regular STI testing, vaccination against STIs such as HPV and hepatitis B, and consistent condom use. Routine sexual health examinations involve screening for STIs, cervical cancer, via pap smears, and other reproductive health concerns. Mental health and sexuality. Mental health issues, such as anxiety, depression, trauma, and body image concerns, can impact sexual well-being and satisfaction. Integrating mental health services into sexual health care ensures holistic support for individuals experiencing mental health challenges. Substance use and sexual behavior. Substance use, including alcohol and drugs, can influence sexual decision-making, risk-taking behavior, and sexual consent. Understanding the relationship between substance use and sexual behavior is crucial for harm reduction and promoting safer sex practices. *** Body image and sexual satisfaction. Body image and sexual satisfaction. Body image refers to one's perception and feelings about their own body's appearance, including size, shape, and physical attributes. Positive body image is associated with greater sexual satisfaction and comfort in intimate relationships, while negative body image can contribute to sexual anxiety and dissatisfaction. Addressing body image concerns involves promoting self-acceptance, challenging unrealistic beauty standards, and fostering body positivity. Coping with sexual trauma and abuse. Sexual trauma and abuse encompass experiences of unwanted or non-consensual sexual activity, including assault, harassment, and exploitation. Coping strategies for survivors of sexual trauma may include therapy, support groups, self-care practices, and seeking justice and accountability. Providing trauma-informed care and support is essential for promoting healing and empowerment among survivors. Comprehensive databases of sexual health research articles and clinical trials, 1TB. Access to extensive databases of sexual health research articles and clinical trials provides valuable resources for educators, researchers, healthcare professionals, and policymakers. These databases contain a wealth of peer-reviewed studies, epidemiological data, intervention evaluations, and treatment outcomes, contributing to evidence-based practice and policy development. By synthesizing and disseminating research findings, these databases facilitate informed decision-making, program development, and public health initiatives aimed at promoting sexual health and well-being. Module 16, Speech Communication and Health. Introduction to Speech Communication. Speech communication is the process of exchanging information through spoken language, involving the production, transmission, and reception of verbal messages. It encompasses various aspects such as articulation, pronunciation, vocalization, intonation, and modulation of speech. Effective speech communication is crucial for conveying thoughts, emotions, ideas, and intentions, facilitating social interaction, and promoting understanding and cooperation. Anatomy of speech production. The anatomy of speech production involves the structures and organs responsible for generating speech sounds. Key components include the larynx, voice box, vocal cords, pharynx, oral cavity, tongue, lips, and nasal cavity. These anatomical structures work together to produce speech sounds through coordinated movements and airflow modulation. Physiology of speech production. The physiology of speech production refers to the physiological processes involved in creating speech sounds. It includes muscle contractions, air pressure changes, and the coordination of respiratory, phonatory, and articulatory systems. Speech production requires precise neuromuscular control and integration of sensory feedback to produce intelligible speech. Language development and acquisition. Language development and acquisition encompass the processes through which individuals learn and acquire language skills. This includes phonological, morphological, syntactic, semantic, and pragmatic aspects of language. Language acquisition typically begins in early childhood and progresses through exposure, imitation, reinforcement, and interaction with caregivers and peers. Verbal and nonverbal communication. Verbal communication involves the use of spoken or written language to convey messages, thoughts, and information. Nonverbal communication refers to the transmission of messages through gestures, facial expressions, body language, posture, eye contact, and tone of voice. Both verbal and nonverbal communication play essential roles in interpersonal communication, social interaction, and conveying emotions and attitudes. Communication disorders. Communication disorders are conditions that affect an individual's ability to produce, understand, or use language effectively. Examples include speech disorders, for example, stuttering, dysarthria, language disorders, for example, aphasia, developmental language disorder, and voice disorders, for example, hoarseness, vocal nodules. These disorders can result from various causes, including neurological conditions, developmental delays, physical impairments, or environmental factors. Cultural and societal influences on communication. Cultural and societal factors influence communication norms, behaviors, and patterns within different social groups and communities. These influences include cultural values, beliefs, customs, language diversity, social norms, and power dynamics. Understanding cultural and societal contexts is essential for effective communication, intercultural competence, and building rapport and trust in diverse settings. Advanced speech synthesis and natural language processing technologies. Advanced speech synthesis technologies involve the generation of artificial speech using computer algorithms and models. Natural language processing, NLP, technologies focus on the interaction between computers and human language, enabling machines to understand, interpret, and generate natural language. These technologies have applications in speech recognition, virtual assistants, language translation, text-to-speech systems, and automated communication platforms. Multimodal communication studies integrating speech, gesture, and facial expressions. Multimodal communication studies examine the integration of multiple communication modalities, including speech, gestures, facial expressions, and body language. Research in this field investigates how different modalities interact to convey meaning, emotions, and intentions in communication. Understanding multimodal communication enhances our comprehension of human interaction, nonverbal cues, and cross-cultural communication dynamics. Cross-cultural communication analysis and linguistic anthropology research. Cross-cultural communication analysis examines communication patterns, behaviors, and norms across different cultural contexts. Linguistic anthropology research explores the relationship between language, culture, and society, studying language use, variation, and change within cultural groups. These fields provide insights into how cultural factors shape communication practices, identities, and social interactions globally. Massive repositories of linguistic corpora and speech databases for computational linguistics research. Linguistic corpora are large collections of written or spoken texts used for linguistic analysis and research. Speech databases contain recorded speech samples and annotations for studying speech patterns, dialects, and language variation. Computational linguistics research utilizes these repositories to develop algorithms, models, and tools for analyzing, processing, and generating human language computationally. Module 17, Kinesiology and Athletics. Introduction to Kinesiology. Kinesiology is the study of human movement, encompassing the biomechanical, physiological, and psychological aspects of physical activity. It examines how the body moves, functions, and adapts to various forms of exercise, sports, and physical tasks. Kinesiology integrates knowledge from anatomy, physiology, biomechanics, motor control, and psychology to understand movement patterns, performance, and injury prevention. Biomechanics of human movement. Biomechanics explores the mechanical principles governing human movement, including the forces, torques, and motion of the body. It analyzes the interaction between the skeletal system, muscles, tendons, ligaments, and joints during activities such as walking, running, jumping, and lifting. Biomechanical analysis involves measuring parameters like velocity, acceleration, force, torque, and joint angles to assess movement efficiency, performance, and injury risk. Muscle function and movement analysis. Muscle function refers to the contraction and relaxation of muscles to produce movement and generate force. Movement analysis involves examining muscle activation patterns, muscle recruitment strategies, and joint kinematics during various activities. Techniques such as electromyography, EMG, force plates, motion capture systems, and 3D kinematic analysis are used to study muscle function and movement mechanics. Joint structure and function. Joints are anatomical structures that connect bones and facilitate movement. Joint structure refers to the composition and arrangement of bones, cartilage, ligaments, and synovial fluid within a joint. Joint function involves the range of motion, stability, and biomechanical properties of a joint, influenced by factors like muscle strength, flexibility, and joint integrity. Exercise physiology. Exercise physiology investigates the physiological responses and adaptations to physical activity and exercise. It examines the cardiovascular, respiratory, metabolic, and neuromuscular systems' responses to different types and intensities of exercise. Exercise physiologists study topics such as energy metabolism, oxygen consumption, heat regulation, and fatigue during exercise. Motor learning and control. Motor learning is the process of acquiring and refining motor skills through practice, feedback, and experience. Motor control involves the neurological mechanisms that govern movement coordination, timing, and precision. Understanding motor learning and control principles is essential for skill acquisition, performance enhancement, and injury prevention in sports and physical activities. Sports injury prevention and rehabilitation. Sports injury prevention strategies aim to reduce the risk of athletic injuries through proper training, equipment use, biomechanical analysis, and conditioning programs. Rehabilitation focuses on restoring function, mobility, and strength following sports-related injuries through exercises, physical therapy, and rehabilitative interventions. Sports medicine professionals, including athletic trainers, physical therapists, and sports physicians, play key roles in injury prevention and rehabilitation. Advanced motion capture systems and biomechanical modeling software. Motion capture systems use cameras, sensors, and markers to record and analyze human movement in 3 dimensions. Biomechanical modeling software allows researchers to create virtual models of the human body and simulate movement patterns, joint forces, and muscle activations. These technologies enable detailed biomechanical analysis, performance assessment, and injury prevention strategies in sports and rehabilitation settings. High-resolution muscle imaging techniques and electromyography analysis. High-resolution muscle imaging techniques, such as ultrasound and magnetic resonance imaging, MI, provide detailed visualization of muscle structure, architecture, and function. Electromyography, EMG, measures the electrical activity of muscles during movement, providing insights into muscle recruitment patterns, activation timing, and coordination. Combined, these methods offer comprehensive assessments of muscle function, biomechanics, and performance in athletes and individuals undergoing rehabilitation. Sports biomechanics simulations and performance optimization algorithms. Sports biomechanics simulations use computational models and algorithms to simulate athletic movements, analyze performance, and optimize technique. Performance optimization algorithms integrate biomechanical data, physiological parameters, and training variables to enhance athletic performance and reduce injury risk. These computational tools assist coaches, athletes, and sports scientists in refining training programs, improving technique, and maximizing athletic potential. Global databases of sports injury epidemiology and rehabilitation protocols. Global databases compile epidemiological data on sports-related injuries, including injury rates, types, mechanisms, and risk factors across different sports and populations. Rehabilitation protocols outline evidence-based guidelines and strategies for managing sports injuries, promoting recovery, and preventing re-injury. Access to these databases facilitates research, injury surveillance, and the development of effective injury prevention and rehabilitation programs in sports medicine and athletic training. Module 18, Athletics and Performance Enhancement. Introduction to Athletics. Athletics refers to a collection of sports that involve running, jumping, throwing, and other physical activities. It encompasses various disciplines such as track and field, gymnastics, swimming, cycling, and team sports like basketball, soccer, and volleyball. Athletics involves both individual and team competitions, often requiring different skill sets, training methods, and performance strategies. Training principles and techniques. Training principles are fundamental guidelines governing the design and implementation of effective exercise programs. They include specificity, overload, progression, reversibility, and individualization, among others. Training techniques refer to specific exercises, drills, and methodologies used to improve athletic performance, strength, speed, endurance, and flexibility. Nutrition and hydration for athletes. Nutrition and hydration are critical components of athletic performance, recovery, and overall health. Athletes require proper macronutrients, carbohydrates, proteins, fats, and micronutrients, vitamins, minerals, to fuel their training and optimize performance. Hydration is essential to maintain fluid balance, regulate body temperature, and support physiological functions during exercise. Sports psychology. Sports psychology examines the psychological factors influencing athletic performance, motivation, and mental well-being. It encompasses areas such as goal setting, motivation, confidence, concentration, anxiety management, and visualization techniques. Sports psychologists work with athletes to enhance their mental skills, resilience, and overall psychological readiness for competition. Performance enhancement strategies. Performance enhancement strategies are methods and interventions aimed at improving athletic performance and maximizing potential. They include strength and conditioning programs, biomechanical analysis, technical skill development, and recovery protocols. Legal performance enhancement strategies prioritize health, safety, and ethical considerations, promoting long-term athletic development and success. Injury management and recovery. Injury management involves the prevention, assessment, treatment, and rehabilitation of sports-related injuries. It includes strategies such as injury prevention exercises, proper warm-up and cool-down routines, rest and recovery protocols, and rehabilitation exercises. Effective injury management minimizes downtime, promotes healing, and reduces the risk of recurrent injuries in athletes. Sports ethics and governance. Sports ethics refers to the moral principles, values, and standards governing fair play, integrity, and sportsmanship in athletics. It addresses issues such as doping, cheating, match fixing, discrimination, and respect for opponents and officials. Sports governance involves the administration, regulation, and management of sports organizations, leagues, and competitions at local, national, and international levels. Elite athlete training programs and coaching strategies. Elite athlete training programs are highly specialized, individualized training regimens designed to optimize the performance of professional and Olympic-level athletes. These programs incorporate advanced training techniques, periodization models, recovery protocols, and performance monitoring strategies tailored to the athlete's specific needs and goals. Coaching strategies involve the application of coaching principles, communication skills, and technical expertise to maximize athlete development, performance, and success. Precision nutrition and personalized training regimens. Precision nutrition involves the precise manipulation of dietary intake to match an athlete's energy expenditure, nutrient requirements, and training goals. Personalized training regimens are customized exercise programs tailored to an athlete's physiological characteristics, performance metrics, and training history. These approaches optimize training adaptations, performance outcomes, and overall athlete well-being through individualized nutrition and training interventions. Sports psychology interventions for peak performance and mental resilience. Sports psychology interventions aim to enhance mental skills, psychological resilience, and performance mindset in athletes. They include techniques such as goal setting, imagery, self-talk, relaxation training, cognitive restructuring, and stress management. These interventions improve focus, confidence, motivation, and emotional control, enabling athletes to perform at their best under pressure. Global sports governance policies and regulations databases. Global sports governance policies and regulations databases compile rules, policies, and guidelines established by international sports federations, governing bodies, and regulatory agencies. They cover areas such as anti-doping regulations, athlete eligibility criteria, competition rules, and ethical standards. Access to these databases ensures compliance with sports governance requirements, facilitates rule interpretation, and promotes transparency and accountability in sports administration. Elite athlete training programs and coaching strategies. Elite athlete training programs are highly specialized, individualized training regimens designed to optimize the performance of professional and Olympic-level athletes. These programs incorporate advanced training techniques, periodization models, recovery protocols, and performance monitoring strategies tailored to the athlete's specific needs and goals. Coaching strategies involve the application of coaching principles, communication skills, and technical expertise to maximize athlete development, performance, and success. Precision nutrition and personalized training regimens. Precision nutrition involves the precise manipulation of dietary intake to match an athlete's energy expenditure, nutrient requirements, and training goals. Personalized training regimens are customized exercise programs tailored to an athlete's physiological characteristics, performance metrics, and training history. These approaches optimize training adaptations, performance outcomes, and overall athlete well-being through individualized nutrition and training interventions. Sports psychology interventions for peak performance and mental resilience. Sports psychology interventions aim to enhance mental skills, psychological resilience, and performance mindset in athletes. They include techniques such as goal setting, imagery, self-talk, relaxation training, cognitive restructuring, and stress management. These interventions improve focus, confidence, motivation, and emotional control, enabling athletes to perform at their best under pressure. Global sports governance policies and regulations databases. Global sports governance policies and regulations databases compile rules, policies, and guidelines established by international sports federations, governing bodies, and regulatory agencies. They cover areas such as anti-doping regulations, athlete eligibility criteria, competition rules, and ethical standards. Access to these databases ensures compliance with sports governance requirements, facilitates rule interpretation, and promotes transparency and accountability in sports administration. Introduction to neural networks. Neural networks are computational models inspired by the structure and function of biological neural networks in the brain. They consist of interconnected nodes called neurons, organized in layers, which process and transmit information through weighted connections. Neural networks are capable of learning from data, identifying patterns, and making predictions or decisions without being explicitly programmed. Biological neural networks versus artificial neural networks. Biological neural networks refer to the complex networks of interconnected neurons found in the nervous systems of living organisms, including humans. Artificial neural networks, ANNs, are mathematical models designed to mimic the behavior of biological neurons and neural networks in computer systems. While biological neural networks are highly adaptable and capable of complex processing, artificial neural networks are engineered for specific computational tasks. Neural network architectures and models. Neural network architectures refer to the structure and organization of neurons and connections within a neural network model. Common architectures include feed-forward, recurrent, convolutional, and deep neural networks. Each architecture has unique characteristics and is suited to different types of tasks, such as classification, regression, sequence prediction, or image recognition. Learning algorithms in neural networks. Learning algorithms are mathematical techniques used to adjust the parameters of neural networks during training to minimize errors and improve performance. Supervised learning algorithms, such as backpropagation, use labeled data to adjust network parameters based on the discrepancy between predicted and actual outputs. Unsupervised learning algorithms, like clustering and autoencoders, identify patterns and structures in unlabeled data without explicit guidance. Applications of neural networks in medicine and healthcare. Neural networks have numerous applications in medicine and healthcare, including medical imaging analysis, disease diagnosis, drug discovery, personalized medicine, and predictive analytics. They can analyze complex medical data, such as MRI scans, CT images, genomic sequences, and electronic health records, to assist clinicians in decision-making and improve patient outcomes. Ethical considerations in neural network research and development. Ethical considerations in neural network research and development involve issues related to data privacy, transparency, fairness, accountability, bias, and unintended consequences. researchers and developers must address ethical concerns to ensure that neural network technologies are used responsibly and ethically in healthcare settings. Advanced neural network frameworks and deep learning libraries. Advanced neural network frameworks and deep learning libraries provide software tools and APIs for building, training, and deploying neural network models efficiently. Examples include TensorFlow, PyTorch, Keras, CAF, and MXNet, which offer a wide range of functionalities, including automatic differentiation, GPU acceleration, and pre-trained models. Big data analytics platforms for neural network training and optimization. Big data analytics platforms enable the storage, processing, and analysis of large volumes of data required for training and optimizing neural network models. These platforms, such as Apache Hadoop, Spark, and Databricks, provide distributed computing capabilities and scalable infrastructure for handling massive datasets efficiently. Neural network applications in medical imaging analysis and disease diagnosis. Neural networks are extensively used in medical imaging analysis for tasks such as image segmentation, feature extraction, and object detection. They contribute to disease diagnosis by assisting radiologists in identifying abnormalities, tumors, or lesions in medical images, including X-rays, MRIs, CT scans, and histopathological slides. Datasets of neural network simulations and computational neuroscience models. Datasets of neural network simulations and computational neuroscience models comprise collections of simulated neural networks and computational models used for studying brain function and behavior. These datasets facilitate research in computational neuroscience, cognitive science, and artificial intelligence by providing standardized benchmarks and reference datasets for evaluating neural network algorithms and architectures. Physics of the body. Physics of the body refers to the application of principles and concepts from physics to understand the mechanical, electrical, and thermodynamic processes within the human body. It includes topics such as biomechanics, fluid dynamics, thermoregulation, and electromagnetism as they relate to physiological functions and movements. Neurology of the body. Neurology of the body involves the study of the nervous system, including the brain, spinal cord, and peripheral nerves, and their role in controlling and coordinating bodily functions. It encompasses topics such as neuroanatomy, neurophysiology, neurochemistry, and neuropharmacology, focusing on understanding neurological disorders and their treatment. Neuroscience of the body. Neuroscience of the body explores the interdisciplinary study of the nervous system and its relationship to behavior, cognition, and emotion. It integrates knowledge from biology, psychology, chemistry, and other fields to investigate neural mechanisms underlying perception, learning, memory, and consciousness. Cognitive science of the body. Cognitive science of the body examines how cognitive processes, such as perception, attention, memory, language, and problem-solving, are manifested in the body. It explores the interplay between mental processes and physiological states, investigating how the body influences cognitive functions and vice versa. Psychology of the body. Psychology of the body explores the psychological aspects of bodily experiences, sensations, emotions, and behaviors. It encompasses topics such as body image, self-perception, emotional regulation, and psychosomatic disorders, emphasizing the interaction between mental and physical health. Intelligence of the body. Intelligence of the body refers to the inherent adaptive and regulatory capacities of the human body to maintain homeostasis, respond to stimuli, and coordinate complex physiological processes. It includes autonomic functions, such as heart rate regulation, as well as higher-order cognitive functions, such as problem-solving and decision-making. Artificial intelligence of the body. Artificial intelligence, AI, of the body involves the development and application of AI technologies to analyze, interpret, and simulate biological systems and processes within the body. It includes areas such as computational biology, bioinformatics, and medical informatics, aiming to enhance understanding and diagnostics in health sciences. Sociology of the body. Sociology of the body examines the social and cultural meanings attributed to the human body and how these influence identity, behavior, and social interactions. It explores topics such as body politics, beauty standards, gender roles, and embodiment, highlighting the intersection of biology and society in shaping perceptions of the body. Language arts of the body. Language arts of the body refers to the various forms of nonverbal communication, including gestures, facial expressions, posture, and body language, used to convey meaning and emotions. It encompasses the study of kinesics, proxemics, and paralanguage, exploring how body movements and signals communicate information in interpersonal and social contexts. Physical therapy of the body. Physical therapy of the body involves the rehabilitation and restoration of physical function, mobility, and strength through therapeutic exercises, manual techniques, and modalities. It aims to prevent, manage, and rehabilitate musculoskeletal injuries, neurological disorders, and other conditions affecting movement and function. Stretching of the body. Stretching of the body involves the deliberate elongation and relaxation of muscles and connective tissues to improve flexibility, range of motion, and muscle extensibility. It includes static, dynamic, ballistic, and proprioceptive neuromuscular facilitation, PNF, stretching techniques used in fitness, sports, and rehabilitation programs. Yoga of the body. Yoga of the body refers to the ancient practice of physical postures, asanas, breath control, pranayama, and meditation techniques aimed at promoting physical, mental, and spiritual well-being. It encompasses various styles and traditions of yoga, such as Hatha, Vinyasa, and Kundalini, emphasizing harmony between the body, mind, and spirit. Therapies of the body. Therapies of the body encompass a wide range of therapeutic interventions aimed at promoting health, healing, and well-being at the physical, emotional, and energetic levels. They include massage therapy, acupuncture, chiropractic care, osteopathy, hydrotherapy, and other complementary and alternative medicine, CAM, modalities. Digestion of the body. Digestion of the body refers to the process of breaking down food into nutrients, absorbing them into the bloodstream, and eliminating waste products from the body. It involves the digestive organs, such as the mouth, esophagus, stomach, intestines, liver, and pancreas, as well as digestive enzymes and hormones. Detoxification of the body. Detoxification of the body involves the removal of harmful toxins, pollutants, and metabolic byproducts from the body to maintain health and prevent disease. It includes natural detoxification. Module 20, Sociology of Health and Medicine. Introduction to Sociology of Health. Sociology of health examines how social factors influence health outcomes, healthcare delivery, and the experience of illness within societies. It encompasses the study of healthcare systems, health policies, medical practices, and the social determinants of health. Social determinants of health. Poverty, lack of financial resources can limit access to healthcare, nutritious food, safe housing, and education, leading to poorer health outcomes. Education, Higher levels of education are associated with better health outcomes due to increased health literacy, better job opportunities, and healthier lifestyle choices. Race. Racial disparities in health outcomes exist due to systemic racism, unequal access to healthcare, environmental racism, and socioeconomic inequalities. Gender. Gender influences health through biological differences, gender norms, access to healthcare, and exposure to discrimination and violence. Social class. Socioeconomic status affects health through access to resources, living conditions, occupational hazards, and stresses associated with poverty. Geography. Location impacts health disparities due to differences in access to healthcare facilities, environmental conditions, and community resources. Culture. Cultural beliefs, practices, and values influence health behaviors, healthcare utilization, and perceptions of illness and wellness. Medicalization and social construction of illness. Medicalization refers to the process by which non-medical problems or behaviors become defined and treated as medical conditions. The social construction of illness emphasizes how societal norms, values, and institutions shape perceptions of health, illness, and medical intervention. Health inequalities and health disparities. Health inequalities refer to differences in health outcomes between individuals or groups, often due to social, economic, or environmental factors. Health disparities are systematic, avoidable differences in health outcomes that disproportionately affect disadvantaged populations, perpetuating inequality. Healthcare systems. Public versus private. Public healthcare systems are funded and operated by the government, providing healthcare services to all citizens, while private healthcare systems involve privately owned hospitals and clinics that offer services for a fee. Universal healthcare. Universal healthcare ensures that all residents have access to essential healthcare services without financial hardship, often through government-funded programs or insurance schemes. Patient-physician interactions and medical ethics. Patient-physician interactions involve the communication, trust, and decision-making processes between patients and healthcare providers. Medical ethics encompasses principles of beneficence, non-maleficence, autonomy, and justice, guiding ethical decision-making in healthcare. Global health governance and health policies. Global health governance refers to international efforts to address global health challenges, coordinate responses, and develop policies to improve health outcomes worldwide. Health policies are government strategies, regulations, and programs aimed at promoting public health, preventing disease, and ensuring access to healthcare services. Social support networks and health outcomes. Social support networks, including family, friends, and community organizations, play a crucial role in buffering stress, providing emotional support, and facilitating access to resources, thereby influencing health outcomes. Cultural competence in healthcare delivery. Cultural competence involves healthcare providers' ability to understand, respect, and effectively communicate with patients from diverse cultural backgrounds, ensuring culturally sensitive and responsive care. Stigma and discrimination in health. Stigma refers to negative attitudes, beliefs, and stereotypes associated with certain health conditions, which can lead to discrimination, social exclusion, and barriers to healthcare access for affected individuals. Module 21, Psychology of Health and Well-Being. Introduction to Health Psychology. Health psychology is a field that explores the psychological processes underlying health, illness, and healthcare. It examines how biological, psychological, and social factors interact to influence health behaviors, coping mechanisms, and overall well-being. Biopsychosocial model of health. Biological factors. Physical health is influenced by genetic predispositions, physiological processes, and neurobiological mechanisms. Psychological factors. Mental health, emotions, cognition, personality traits, and coping styles impact health behaviors, stress responses, and illness outcomes. Social factors. Social support, interpersonal relationships, cultural norms, socioeconomic status, and environmental influences affect health behaviors and access to resources. Health behavior change and motivation. Health behavior change involves adopting or modifying behaviors to promote health and prevent illness, influenced by individual motivations, beliefs, and social contexts. Motivational theories such as self-determination theory, trans-theoretical model, and health belief model provide frameworks for understanding behavior change processes. Stress and coping mechanisms. Stress is the body's physiological and psychological response to perceived threats or challenges, involving activation of the sympathetic nervous system and release of stress hormones. Coping mechanisms are adaptive strategies individuals use to manage stressors, including problem-solving, emotion regulation, social support seeking, and cognitive reframing. Illness perception and health beliefs. Illness perception refers to individuals' subjective beliefs, attitudes, and interpretations of their health condition, influencing coping strategies, treatment adherence, and recovery outcomes. Health beliefs encompass individuals' beliefs about health, illness causation, treatment efficacy, and preventive behaviors, shaped by cultural, familial, and personal experiences. Health promotion and disease prevention. Health promotion involves activities aimed at enhancing well-being, preventing illness, and fostering healthy behaviors through education, community initiatives, and policy interventions. Disease prevention strategies target modifiable risk factors, promote healthy lifestyles, and encourage early detection and intervention to reduce the burden of preventable diseases. Psychology of pain and pain management. The psychology of pain examines the psychological, cognitive, and emotional aspects of pain perception, modulation, and coping. Pain management techniques include pharmacological interventions, cognitive behavioral therapies, relaxation techniques, and mindfulness practices to alleviate pain and improve quality of life. Psychological factors in chronic illness and recovery. Psychological factors such as resilience, social support, coping skills, and self-efficacy influence adjustment to chronic illness, treatment adherence, and recovery trajectories. Integrated biopsychosocial interventions address physical, psychological, and social aspects of chronic illness management to optimize patient outcomes. Positive psychology and well-being interventions. Positive psychology focuses on enhancing well-being, resilience, and flourishing through the cultivation of positive emotions, strengths, virtues, and meaningful life experiences. Well-being interventions include gratitude exercises, kindness practices, resilience training, and mindfulness-based interventions to promote psychological flourishing and enhance overall quality of life. Mindfulness and meditation practices for health. Mindfulness and meditation involve intentional, non-judgmental awareness of present moment experiences, promoting stress reduction, emotional regulation, and cognitive flexibility. Mindfulness-based interventions, such as mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, have been effective in improving mental health, pain management, and overall well-being. Databases of psychological research on health behavior and well-being, 1TB. Comprehensive databases contain vast collections of peer-reviewed research articles, empirical studies, and clinical trials exploring various aspects of health psychology, behavior change, and well-being interventions.